anybody has any questions of me, please just contact me anytime. Open door.
Thank you so much.
Thank you.
Thank you, Jeff. Now moving to proceeding to committee agenda. Agenda item number 1, approve the minutes of the November 15th, 2023 Budget and Finance Committee. Do I have a motion? Manager Brinson?
I move to accept the minutes from the November Budget and Finance Committee meeting.
Thank you. Do I have a second? Manager Bella does second, so I have a motion on the table and a second. Any further discussion? I see none. All in favor?
Aye.
Any opposed? Any abstention? No, so the motion passes. Members, I will be calling items 2 and 3 together as they are related, but we will need separate motions for each item at the conclusion of the presentation. So item number 2, receive an update on the Central Health's investment policy and strategy for fiscal year 2024 and adopt the fiscal year 2024 Central Health investment policy as presented by the Travis County Cash Investment Management Department. We have Mr. Jeff Knodel and Debbie Laddermilk, Chief Investment Officer for Travis County, will be presenting. Welcome.
Thank you. I'll kick us off. Jeff Knodel, Chief Financial Officer, and Debbie will do most of the presentation. I'm just going to kick it off and say that the Travis County Investment Office manages Central Health's cash and investments. If we go to the next slide. And so part of that responsibility is helping Central Health manage its investment policy, and so we're requesting action tonight as part of a best practice, which is typically reviewing the investment policy and the approved investment brokers and dealers and bringing it to the board for approval. So our requested action, as the board read out, is to approve the investment policy and the list of investment brokers and dealers. Next slide. So as I mentioned, Travis County, they manage our Central Health investments through an interlocal agreement. And again, you see some of the functions that they perform for us as far as managing our investments in cash, and then adherence to investment policies and what's called the Texas Public Funds Investment Act, which you'll hear a little bit more of here. And then also just monitoring any potential or actual legislative changes that may impact the Central Health's ability to invest in certain instruments. So with that, I'm going to turn it over to Debbie to walk through the presentation.
Nice to be here tonight to talk about investments. We are governed by, as Jeff said, legislative 2256, Public Funds Investment Act. So it limits our investments to a great extent. But this first slide I wanted to point out, this is the guidance and rule that every investor should go by, and that's the prudent person rule, because you want reasonable income and you want preservation of capital. The Public Funds Investment Act, the next slide, sorry. We are under those guidelines, and it pretty much tells us what we can invest in, and we have to monitor that, as Jeff said, every legislative session to see if there's any changes. Fortunately, this past year there were no legislative changes. There was some discussion about some companies as to whether or not they had anything to do with arms and green energy, but that never got through. So, and the things that we invest in, this really wouldn't be an issue. The key principles of the Public Funds Investment Act: number 1, safety of principal. We want our money back when we invest it. The next is liquidity, to make sure we can meet cash flow needs. And then the last is return on investments. So this has been some interesting times lately with interest rates near zero, but now they have recovered to Fed funds rate is between 5.25% to 5.50%, and the Fed announced today that they weren't doing another increase at this point in time. So, and the economic data that's coming in does look like at the moment that they will be able to stay with their current rates, but we will see, because you never know. So the investment policy must be written. It has to also discuss what investments were allowed and the percentages and the mix and everything else, and you have to update it annually. It was updated at Travis County in September, and so this is coming to you now to update your policy, which is essentially the same as our policy. The investment policy includes types of authorized investments and how long you can hold them, the maturity dates, and then also the weighted average maturity.
Debbie, if I may, I'm sorry, for item 3, I forgot to take it, so are you presenting on item 3 as well?
Yes.
Yes.
So if I may read it out,
Sure.
sorry. So item number 3, receive and discuss approval of the fiscal year 2024 broker-dealer applicants for conducting investment business with the Travis County Healthcare District, DPA Central Health, as recommended by the Travis County Cash Investment Management Department. Please move. Proceed.
So if there's any questions about the investment policy, essentially we invest in government agencies, which are guaranteed by the United States government, treasuries, municipals, highly rated municipals, and highly rated commercial paper. The other thing that it's the liquid investments that we use are called LGIPs, local government, I forget what the other two. Investment pools. And those, it's almost like a bank account that you can take the money in and out every day, but you get a reasonable rate. And right now, most of them are paying 5.25% to 5.5%. So it's a nice way to earn some good income, and it's liquid. So,
So just to wrap up, so we're requesting approval of the Central Health Investment Policy and then an approved list of investment broker dealers, which was in the packet, that was part of the packet, that was information that was included in your packet.
Thank you.
just a quick note on the broker-dealer list. We review it every year, but we only take new applications every 2 years because it became a lot of work for not much return. So, and we've limited the number of broker-dealers that we'll do business with to 10 because of the volume of investments that we do. It just doesn't make sense, and that way the people that you do business with are a little more willing to help make sure you get the right investment, the best investment for us. And we also consider the minority brokers also, so we have several of those on our list.
Thank you so much. Appreciate it. I have a motion. I have actually two motions, so this is a little confusing. Like we need to go through them. So, can Manager Martin, can you read the first motion?
So number 2. One more time. I move that the committee recommend that the board approve the fiscal year 2024 Central Health Investment Policy as presented by the Travis County Cash Investment Management Department.
Thank you, Manager Martin. Manager Kitchen, do you second? Sure. So I have a motion and a second. Any discussions on this motion? Manager Kitchen and then Manager Valdez.
Just a quick question. Are there any substantive changes since last year? In other words, anything that makes any difference that you would like to bring to our attention?
In the investment policy?
Yeah.
No, none of
Okay.
it. There were no changes whatsoever.
Thank you.
Thank you, Manager Kitchen. Manager Valdez.
Mine is probably you may have explained it, but I just wanted to make sure I understood. You said you have minority brokers on a list. But does that
On the
list?
approved list.
On the approved list, but are you using the minority brokers?
Yes.
Okay, just wanted to make sure that they were being used and not just sitting on a list somewhere. Thank you very much.
Thank you, Manager Valdez. So I have a motion and a second, and we discussed it. All in favor?
Aye.
So I see Manager Jones. Okay, so the motion passes. Second motion, Manager Motwani, can you make that motion?
I move that the committee recommend that the board approve the fiscal year 2024 broker-dealer applicants for conducting investment business with Central Health as recommended by the Travis County Cash Investment Management Department.
Thank you. So I have a motion on the table by Manager Motwani, a second by Manager Valdez. Any discussion? So I see no discussions. All in favor?
Aye.
And Manager Jones, so the motion passes unanimously. Thank you so much.
Thank you.
And happy holidays. Now moving on to agenda item number 4, receive updates on the preliminary October 2023 financial statements, including capital projects for Central Health and the Community Care Collaborative. Managers, there will be no presentation on this item, but there is material in your backup, and staff are available for any questions. Is there any questions pertaining to those financials? Manager Valdez?
Yes, the financials is solely dealing with community care financials, or is it including Central Health?
It's Community Care Collaborative.
Oh, the CCC.
Yes.
Okay.
Not,
Two sets of financials, Community Care Collaborative and Central Health.
Okay, so then,
And it's for the month of October. These are extremely preliminary statements. Apologies for going out so late last night, but we've really been focused more on the external annual audit. So if you have any questions, you could contact Brianna or
well, mine's going to be a very quick one,
Renee. Sure.
because we received something, I don't know if it was last month or maybe in a subsequent meeting, maybe budget and financial, but I didn't see where there was a notation made for our reserve, contingency reserve amounts. That's one of the reasons I asked, remember about that unrestricted
Yeah.
fund, because I thought that was it,
No.
but you said it was not, so.
It's not, and we're trying to go through a formatting issue. We'll have that ready to go, and we'll point that out in our next presentation.
So from
Exactly
here
what
on
that's
out,
at.
then it will be included?
Yes, we will show, we'll show, actually, we have two reserves that will show balances of kind of, I'm going to call it below the line, so to speak, contingency and emergency reserve. So,
Thank you very much.
Sure. Thank you.
thank you, Jeff. Appreciate it. Now moving on to item number 5, discuss and take appropriate action on the calendar year 2024 budget for Sendero Health Plans. Sharon Alvis and Ili, I am not going to butcher your last name, will be presenting. I announce that the committee is convening in closed session to discuss agenda item 5 under Texas Government Code 551.085, governing board of certain providers of healthcare services, and Texas Government Code 551.071, consultation with attorney. So at this, so we are in closed session right now. I'm ready. S- So, do I need to announce a date and time? Okay, so, we are out of closed session, now to open session. It is December 13th, 2023, and it is 4:47 PM. I want to recognize our Sendero staff. Welcome again. So if you have anything that you would like to share with our community.
Thank you very much. I would just like to take this opportunity to remind everyone that open enrollment ends on this Friday, December 15th. And if you in fact, well, that's for effective on January 1st. So there is open enrollment after that, but we suggest that everybody act now so you can be effective on January 1st. So just a friendly reminder, and if you'd like to, if you need assistance, you can reach out to the Sendero team, either at enroll.senderohealth.com, or the phone number is 844-919-1450, and we have staff on hand that are licensed to take care of you and to help you get accepted. So thank you very much for allowing us to remind everybody of how important that is.
Thank you so much. Manager Valadez?
Could you please let me know whether or not, or let the public know whether or not that's a 24-hour number or not? Are there certain hours?
It's 8 a.m. to 8 p.m. and it'll be till midnight on Saturday, the 15th.
Okay, and I just wanted to give you some feedback from what I'm hearing in the community that is greatly appreciative of your investment in the advertisement. Throughout, I stream, I don't get regular cable anymore, and I've seen you all everywhere myself, but I've gotten calls from people who are really excited, and one person who was, where did y'all get all this money from? Had to explain to them, but this is a marketing investment, and we're showing support for our created nonprofit.
Thank you so much. And, Manager Jones?
Yes, I'd just like to piggyback off of what Manager Valdez just said. I've had several questions about Sendero being visible in the community. Certainly over the last several weeks, I've been very impressed with the marketing that's going forward. So I just want to acknowledge that.
Thank you, Manager Jones, and thank you all for what you do. I have a motion here. Just want to, Manager Chair Belt, can you make that motion for us?
I move that the committee recommend that the board approve the calendar year 2024 budget for Sendero Health Plans.
Second.
So we have a motion and a second. Any further discussions? No, none. All in favor?
Aye.
The motion passes unanimously. Thank you so much, and thank you for reminding our community members of the deadline to sign up for Sendero Health Plans. Thank you. Thank you so much. Now, at this time, I move to confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, January 24th, 2024 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment.
I move adjournment.
Second.
I have a motion for adjournment and a second. All in favor?
Aye.
Aye. Thank you. Motion accepted. We're adjourned.
You were quick.
This is yours.
Quicker than I expected, as a matter of fact. Before I gavel in the next meeting, let the members know that there is food next door, so if you would like to take advantage of that, you can. I think, what? I'm sorry?
Do you want to start in 5 minutes?
Yeah, why don't we start at 5 o'clock? And if you guys want to go in and get a sandwich, come back, we'll start exactly at 5.
Can you DoorDash that here?
Yeah, let me read that number out to you. Ready? Thank you. Good afternoon. Today is December 13th, 2023, and it is 5 o'clock p.m. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. The first item of business is public communications. We will receive public communications for both Executive Committee and the Board of Managers meeting before we proceed to the Executive Committee meeting. Members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 2:30 p.m. today. We do not have anyone registered to make comments, therefore, I will now proceed to the Executive Committee agenda. Agenda item number 1, review and provide direction to staff on the prioritization and tentative scheduling of items for consideration at future Central Health Board and Committee meetings. Brianna will be presenting.
Okay, this will be super quick. So we'll start with our January Eastern Crescent and Strategic Planning Committee meeting, which will be on January 17th. We will have an update on the Black Men's Health Clinic. We will receive a year-end update on communications, community engagement, and community outreach. We will review tentative reporting schedules for FY24, and then receive an update on the Central Health Latino Family Support Conference. On January 17th, we will also have a Budget and Finance Committee meeting. We will have financials and then the FY23 audit and a Sendero enrollment update. On January 24th, we will have Executive Committee and the Board of Managers meeting. For Executive Committee, we'll review tentative schedules and reporting schedules for FY24. And then for the board meeting, we currently have minutes, investments, approving the audit, and then announcing appointments to Central Health Board committees, an integral care update, and then our standing performance review update and lawsuit updates. Are there any questions?
Okay, Manager Musaitif and then Manager Valadez.
Thank you, Brianna. Can you look into possibility in the future at holding our meeting, like a meeting or two outside of Central Health?
Yes.
Thank you.
Yes.
Thank you. Manager Valadez.
I don't know whether I should bring it up now or wait till
Turn your microphone on.
or wait till the first meeting of the year to see whether or not we could add to the agenda conversation and possible action to be taken on evaluation and possibly changing the eligibility criteria for MAP.
Does anybody?
That's what I'd like to put on the agenda. At least we can have a discussion about it.
Yes.
Yeah, just add it to the list and
Okay.
Thank you.
the next chair will determine.
Thank you.
Thank you, Brianna. Any further comments, questions, additions? Hearing none. Agenda item number 2 is to confirm the next regular Executive Committee meeting date, time, and location. Managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, January 24th, 2024, at 4 p.m. That's a lot of fours. Or immediately after the Budget and Finance Committee meeting at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. Manager Musaitif moves adjournment. Manager Brinson seconds. Any further discussion? Hearing none. All in favor? Any opposed? Any abstaining? Motion carries. We are adjourned. Okay, managers, our board meeting is fairly lengthy, so I will go right into the board meeting. Good evening. Today is December 13th, 2023, and it is 5:05 p.m. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. First item of business will be the Local Provider Participation Fund, LPPF, public hearing. This evening's hearing is the official public hearing for the annual LPPF rate setting required by the Texas Health and Safety Code. Notice of this evening's public hearing was published as required by statute. The hearing will begin with staff's presentation of the proposed annual mandatory payment rate. At the conclusion of the presentation, we will invite comments from the public. To make comments during the public hearing, members of the public must either be physically present at Central Health Administrative offices or have registered with Central Health via the online form or by telephone no later than 2:30 p.m. today. We will alternate between speakers who are on site here at Central Health and speakers who have joined the public hearing virtually. Agenda item number 1, receive public comment on the proposed mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2024 under the Local Healthcare Provider Participation Program, LPPF, in Travis County, and how the revenue derived from those payments is to be spent as required by Texas Health and Safety Code, Section 298E.101. Katie Coburn will be presenting.
Good evening, managers. I am Katie Coburn, back here with another LPPF item for you all's consideration. It is our first rate that we are setting for fiscal year 24, which is why we have the public hearing in addition to our usual consideration during the board meeting. And the action we request from you all is to set the FY24 rate for the LPPF at 6% of net patient revenue to fund intergovernmental transfer requirements for these 4 supplemental Medicaid programs. So I was here in September, and you all approved an amendment for the FY23 rate up to that 6%. The 6% is the maximum legal amount allowed by law. And due to the size of the programs that we are hoping to support with this money and the addition of those 2 additional programs, we have worked with stakeholders to determine that let's go ahead and set this at the maximum right now. And then we don't have to come back for amendments throughout the year. So if you want to go to the next. So just as a reminder, the LPPF mandatory payment rate is assessed as a uniform percentage of the net patient revenue of all Travis County inpatient hospitals. You all set the rate. Central Health serves as the LPPF administrator, and we act in a fiduciary capacity to hold the funds in a separate account from Central Health's other revenue and use those to complete intergovernmental transfers for hospitals that serve low-income people. There are limitations to what we can use it for that are prescribed by law. We collaborate with hospital representatives on the use of the funds, and we are paid $150,000 out of those funds for our administrative expenses every year. And as I mentioned, we are requesting the 6% rate for FY24. And I believe that's it. Yes, so there you go. If you on the next slide, you'll see that will bring in about $263 million this year. And that should be the end.
Thank you, Katie. Appreciate it. Yvonne Davila of Central Health Communications Department will briefly cover the guidelines for the public hearing portion of this meeting and will then call upon members of the public to comment. Once Yvonne has recognized a member of the public, please approach the podium if you are physically present, or if you are attending virtually, a member of the staff will unmute your microphone, invite you to turn on your video if you wish. Please begin your comments by stating your name If you're attending the hearing in person at Central Health, staff will direct you where to offer your comments. There is a 3-minute limit for comments per board rule. Yvonne?
Thank you, Mr. Chair. For the purposes of citizens' communications and public hearings held during the course of a Board of Managers meeting, the board will follow the guidelines set below. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail 90 minutes prior to the start of the meeting. Individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. When called upon to speak, please introduce yourself by name before beginning your comments. Each speaker will be limited to 3 minutes. As noted earlier, staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. At this time, I will call on our first speaker, Mr. Jeronimo Rodriguez with Ascension Seton Dell Children's. Jeronimo, are you there?
Yes, sir.
Go ahead, you have 3 minutes.
Yeah, thank you, Mr. Chair and Board of Managers. My name is Jeronimo Rodriguez. I serve as the Chief Advocacy Officer for Ascension Seton Dell Children's Medical Center. And I'm calling in tonight in support of the 6% assessment rate for the local provider participation fund, which helps maximize federal dollars coming for the care of the poor and the vulnerable.
Thank you, Mr. Rodriguez. We appreciate your comments.
Thank you, Jeronimo. Our next speaker is Justin Flores, and he is with HCV. Mr. Flores, are you there?
I am here. Thank you so much, everyone. My name is Justin Flores, and I, at Adelanto Healthcare Ventures, represent Ascension and Baylor Scott and White, as well as a few other of the private hospital providers. I just wanted to, on behalf of our clients, we appreciate Central Health and their ability to consistently come back to the Board of Managers meeting to hear the hospital's request for this LPPF assessment rate, and the providers are in support of said 6% rate. And we appreciate all that y'all are able to do in order to ensure that, like Geronimo mentioned, that hospitals are able to draw down federal dollars associated with seeing the state's most vulnerable patients.
Thank you very much for your comments. Appreciate it.
And Mr. Chair, this was the last of the 2 speakers who signed up to speak.
Thank you very much, Yvonne. And I'd like to again thank everyone for their comments. I'm now ready to accept a motion from Dr. Martin to move that the board close the public hearing.
I move that the board close the public hearing.
Do I have a second? Second. I have a motion from Dr. Martin. I have a second from Manager Valadez. Any further discussion? Hearing none. All in favor?
Aye.
Any opposed? Any abstaining? The public hearing is now closed. We'll move on to the consent agenda. C1, approve the minutes of the Central Health Board of Managers November 15th, November 27th, and November 29th, 2023 meetings. C2, receive the quarterly investment report and ratify Central Health investments for November 2023. C3, adopt the fiscal year 2024 Central Health investment policy as presented by the Travis County Cash/Investment Management Department as recommended by the Budget and Finance Committee. C4, approve the fiscal year 2024 broker/dealer applicants for conducting investment business with the Travis County Healthcare District doing business as Central Health as recommended by the Travis County Cash Investment Management Department as recommended by the Budget and Finance Committee. And C5, approve the calendar year 2024 budget for Sendero Health Plans as recommended by the Budget and Finance Committee. Do I have a motion?
I move that the board
I have a motion from Manager Valdez. Do I have a second? I have a second from Manager Musaitis. Any further discussion? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Members, we will now proceed to the regular agenda. Managers, I will be taking the agenda slightly out of order when we are nearing the time for closed session. Items 11 and 12 are short open session presentations, so we will take up those items before the closed session announcement and before item number 10. Regular agenda, agenda item number 1, discuss and take appropriate action on the proposed mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2024 under the Local Healthcare Provider Participation Program, LPPF, in Travis County, and how the revenue derived from those payments is to be spent as required by the Texas Health and Safety Code 298E.151. Katie,
I'm available for questions.
thank you. Manager Valadez?
Katie, do you have any idea, or are you notified as Central Health being the administrator for these funds, when there is a possibility that that a hospital that's covered within the LPPF is going to be closed? I was just curious about that, because there was a lot of concern from some people that I heard about today.
I have not been notified directly of anyone being closed right now. I am aware of those things and monitor those things from publicly available information. So the answer is no. I am not an automatic person someone would notify if a hospital closes, but when our invoices are not being received or paid, then we follow up and
Is it possible to implement at least a notification process? Notice that they, because it takes a long time. You have to follow a process before they close a hospital. But I'm wondering whether or not that Central Health, as the administrator for this fund, can be one of the people notified once it is seen that there is a hospital that is within the parameters of the LPPF receive monies.
Right. I'm not familiar with that process, or I'm not sure who would notify us, but I can certainly research that and see how we might fit into that process.
I appreciate that, especially for those living in rural areas.
Okay.
Thank you.
Thank you, Manager Valadez. Any further questions? Hearing none, do I have a motion? Manager Kitchen moves that the board approves that the FY24 LPPF mandatory payment rate at 6% of net patient revenue as recommended by staff. Any seconds? Manager Brinson? I have a motion from Manager Kitchen. I have a second from Manager Brinson. Any further discussion or questions? Hearing none, all in favor? Any opposed? Any abstaining? Motion carries. Thank you so much, Katie.
Thank you, Manager.
Appreciate it. I am going to turn over the reading of Agenda Item 2 to Manager Brinson, and Manager Musaitis will be presenting.
Regular agenda item number 2, discuss and take appropriate action on a resolution honoring Dr. Charles Bell for his service as chair of the Central Health Board.
Thank you. Manager Musaitis?
Yes, I never thought I'll be doing this.
No? You sure?
I don't know.
Can we find out?
Go ahead.
Oh, okay,
Please.
sorry. This is a resolution expressing appreciation to Dr. Charles E. Bell for his service on the Board of Managers of Central Health. Whereas Dr. Bell has served on the Board of Managers of Central Health since June 2016 and served as the chairperson of the Board of Managers since January 2022. And whereas Dr. Bell has also served on the Board of Directors for Sendero Health Plans, Inc. since 2012, and served as the chairperson of the Board of Directors at various times from 2016 to 2021. And whereas Dr. Bell served the citizens of the state of Texas as interim commissioner of the Texas Department of Health in 2001, interim commissioner of the Department of State Health Services in 2006, and deputy executive commissioner at the Health and Human Services Commission from March 2003 to August 2011. And whereas Dr. Bell served in many other distinguished positions, including as member of the board of directors of People's Community Clinic, president of the Diabetes Health and Wellness Institute in Dallas, chief of the Bureau of HIV and Sexually Transmitted Disease Prevention, and medical director of the Sexually Transmitted Disease Clinic at the San Antonio Metropolitan Health District. And whereas Dr. Bell currently serves as medical director for the Knowledge, Skills, Training, Assessment, and Research Physician Assessment Program at Texas A&M University. And whereas Dr. Bell generously shared his talents, skills, experience, and leadership from a prestigious career in public service and healthcare excellence. And whereas Dr. Bell has demonstrated unmatched commitment, devotion, and dedication to the vision, mission, and values of Central Health, as well as the causes of health equity. And whereas Dr. Bell led a growing and innovating hospital district in Travis County through expansion of services and the direct practice of medicine, the development and adoption of a healthcare equity plan and corresponding operational and financial sustainability plans, the opening of a new Central Health Clinic site in eastern Travis County, and the selection of a new president and chief executive officer for Central Health. And whereas Dr. Bell has brought steadfast leadership to his role as the chairperson of the Central Health Board of Managers and his continuous improvement. Therefore, be it resolved by Central Health that the board expresses its sincere appreciation and gratitude to Dr. Bell for his dedicated service to Central Health as the chairperson of the Board of Managers.
Thank you. Thank you very much. I would like to accept a motion before I accept the resolution to make it official.
Go ahead.
I move that the board approve the resolution just read honoring Dr. Charles Bell for his service on the Central Health Board.
Thank you. I have a motion by Manager Motwani. Do I have a second? I have a second by Manager Martin. Any further discussion? Hearing none. All in favor? Any opposed?
I've got some discussion.
Oh, you had discussion. I'm sorry. Okay. Let me move back. Manager Motwani.
There's not much more to say beyond, I think, such a lofty resolution, which still doesn't even fractionally encompass so much of what you brought to the table here for all of us and for the community of Travis County, Dr. Bell. And I really feel compelled to just share that personally, professionally, and also as a community member, and a resident of Travis County, I'm so deeply appreciative of your leadership and mentorship, both directly and by example. And I think leadership by example is one of those things that kind of looks easy sometimes and like second nature, but it's not. And when that kind of skill appears like second nature, that's when you know it's really hard. That's when you know you got to work hard to do it. And as we searched for a CEO, it occurred to me that, wow, within like a 150-mile radius, there may be just a handful of people that could do this kind of work. And I thought to myself, how ironic that Dr. Bell is actually one of those people. And for having navigated so much, and frankly, throughout the process, I've seen you navigate a lot of choppy waters to help us accomplish what we've accomplished. at Central Health, and also a lot of abuse, and done so with composure and grace that, again, just sets a tone of leadership by example and goal-based leadership. And we can see that by the track record. So thank you for bringing your emotional, technical, professional, and really just all-around personal excellence to our board, to our community. And it's, culture is set at the top, at the bottom, at the middle, and you definitely have done what it takes to set the culture from the top. So thank you so much.
Thank you, Manager Motwani. Manager Musaitu.
I've struggled. I did not want this day to come. I thank you for being you, for your leadership, for your mentorship, and for your friendship. I am grateful that I have worked alongside with you as a great person, a great leader who has, every time, when I spoke to you, you've enriched me. And you have a sense of calming and easing and making a big problem so simple. But you have led us through grace, through personal humility, and you always put our community at first. And I appreciate you, and I will miss you dearly, but you will not be far away. Just respond to my text.
I promise I will.
Thank you.
Any further discussion?
And
I'm sorry, Manager Kitchen? And-
Yes, I just wanted to say I've been fortunate to serve with you this past year, and you're a person that I've known of for many years through my years in healthcare, and I think we probably crossed paths years ago, but I would echo what others have said and just say thank you, and you will be missed. And we all wish you the very, very best in taking your next steps and taking care of yourself, because this is a tough thing. And we appreciate you serving with us while you did. So.
Thank you very much, Manager Kitchen. Any further discussion? I'm sorry, Manager Jones, sorry.
Yes, I just like to echo what everyone else has said. You've spent a role model for trying to get us through a lot of real challenging times over the last at least few years that I've been working with you. And that's a great role model to set to other people in our community, in particular to people of color, because I think it's important we have role models who can do that. So I'd like to go on record as thanking you, wishing you the best, and knowing that you're going to be successful in wherever and whatever you do. And always remember, Austin is still the capital, so you'll be back and forth hopefully many times.
Thank you so much, Manager Jones. Manager Musaitu?
May I recognize someone? Is that after the vote? Okay. So after the vote, I have to recognize someone.
Sure. Mr. Chair. Manager, excuse me.
No, no, thank you.
Mr. Giesel.
No. Dr. Bell, you and I first met, we were both sitting in front of Senate Finance, and I can't remember while we were there, but it was the wire brushing to be sure. But
as always.
And what we talked about, I don't remember that either. But what I do remember was your poise and how you navigated through issues, and you've never not had a difficult issue in your professional career. And I remember thinking, I need to be more like him in front of Senate Finance. And so you've just, through the years, you've just been a great example and an incredible leader. And on behalf of all the staff here at Central Health, thank you. Thank you for your leadership, your poise, your intellect, your compassion, your emotional intelligence, and your accessibility. Thank you.
Thank you, Mr. Giesel, and thank you, staff. Thank you. Thank you very much. Those comments meant a lot, and I really, really, really do appreciate all the assistance everyone has given me. I didn't move this by myself. Everyone here helped me, and you helped me with grace, you helped me with knowledge, and you helped me when I needed it the most. And that I appreciate more than anything. So thank you so much. I appreciate all the kind words, and I won't be far. So we'll still keep in touch and make sure you guys still develop that system of care that's so badly needed here in Travis County. And I'll be pulling for that from now on. Any further discussion? Hearing none. All in favor? Any opposed? Any abstaining? Motion carries. Well, thank you. I appreciate that. Yeah, we can.
Yeah, all of us. So,
Just squeeze towards the middle. Perfect. Like we've done this before.
A few times.
Okay, hold on. Okay, you go.
Right here for me, all three. 1, 2. Great.
Thank you.
Chair.
I recognize Manager Musaiti.
Thank you, Chair. And I recognize Ms. Sharon Elvis. Chair. Do you want to say?
Dr. Bell, on behalf of the Sendero Board, thank you. On behalf of the Sendero Board and the Sendero team, we have been honored to have you in our organization. I've only had the very briefest time to get to know you, and I was, as everyone has illustrated and indicated today, you are truly an emotionally intelligent leader. Your choice of words, Mike, and that is a rare treat to encounter. And you did give me your phone number, and so I may well take you up on that because I put it in my thing. So for our organization, we have a little tribute for you as well. So thank you so much.
Thank you so much.
Can you two take a picture together with that?
Sure.
Oh, yeah, I'd love to.
Sendero team is here as well.
Yeah, you have your
Want me to go?
Just go around the table. I'm the social media photographer. Edwin's the professional.
You're going to send these to us, right?
Oh, here.
Thank you. Okay. Agenda item number 3. Discuss and take appropriate action on a resolution honoring Mike Gieselin for his service as President and CEO of Central Health. I will be presenting this one, so Mike, you get to be on the other side of this now. And I say that because Mike and I are pretty similar when it comes to being put in the spotlight. Now, it's funny because I told Mike that he's not shy for being put in the bad spotlight. He loves to be in the bad spotlight. But when it comes to putting him in the spotlight that he deserves for the great work that he's done, he's very humble about that. And I can respect that for sure. But I could not let this board meeting go by without telling you thank you and giving you a resolution from the entire board to outline the great service that you have done, not only for Central Health, but for Travis County and beyond. A resolution expressing appreciation to Mike Giesland for his service as Central Health President and Chief Executive Officer. Whereas Mr. Giesland has served as President and CEO of Central Health since May 2017, and whereas Mr. Giesland has also served on the Board of Directors for Central Health Plans, for Sendero Health Plans Incorporated at various times between 2012 and 2023, and the Community Care Collaborative since January 2018, and has served as chairperson of the Community Care Collaborative Board of Directors since March of 2020. And whereas Mr. Giesland served more than 20 years in the state legislative and executive branches and in association leadership roles, and whereas Mr. Giesland served as executive director for the Texas Dental Association in Austin, Texas, before his appointment to Central Health. And whereas Mr. Giesland was chosen by the Board of Managers of Central Health to serve as President and Chief Executive Officer and led the organization for nearly 7 years, and in that time has deservedly garnered respect from the community he serves. And whereas Mr. Giesland has shown boundless dedication to the vision, mission, and values of Central Health, including the cause of health equity. And whereas Mr. Giesland brought his unwavering dedication to the people of Travis County, especially for those who need access to health care the most. And whereas Mr. Giesland led a growing and innovating hospital district in Travis County through many challenges and changes, such as the expansion of services, including the planning and opening of new health and wellness centers, Central Health's first community conversations, enforcement of foundational obligations related to the provision of health care to Central Health's population, the response of Central Health to the COVID-19 pandemic, and the development and adoption of a health equity plan and corresponding operational and financial sustainability plans to supporting the district's direct practice of medicine. And whereas Mr. Giesland has brought steadfast leadership to his role as President and CEO of Central Health and fostered its continuous improvement. And whereas Mr. Giesland has served the patients and staff of Central Health with honor and distinction over the course of his tenure, and it is truly fitting that he receive special recognition. Therefore, be it resolved by Central Health that the Board of Managers for Central Health hereby commend Mr. Giesland on his invaluable leadership in meeting the challenges of the office and extend to him our best wishes for the continued success. So, I would like a motion. Manager Ms. Aitu.
I move that the board approve the resolution just read honoring Mike Giesling for his service as the Central Health President and CEO.
I have a second from Manager Brinson. I have a motion from Manager Musaitif, a second from Manager Brinson. Any further discussion? Manager Musaitif, and then I'll Go around the room.
Do you want to go from the room?
No, go ahead. I can remember.
Mr. Gaisland, I want to really send my heartfelt appreciation and gratitude for your service and for everything you have done to Central Health and for our community at large. I remember when we first met in our first discussion and what we talked about, and it revolved around empathy and compassion, and you have exhibited that throughout your leadership and your tenure on Central Health Board. I'm grateful for working with you and knowing you. You are such a compassionate individual who cares deeply about the work we do, and thank you for your service, and I wish you all the best in your next endeavors and next journey away from us. Thank you so much.
Manager Musaitis, thank you. Manager Kitchen?
I wanted to just say it's just been amazing and so much fun, actually, to work with you. I mean, we worked together years and years ago in a much different context. And so I'm pleased to have had the chance to work with you over this past year. You are very creative, a true problem solver, and you don't give up. And I appreciate all of those things. And so I wish you the best. And I hope that you are, and I know you are, taking time for yourself and your family, and that will be a good thing. So we will miss you here. We will miss you a great deal. But hopefully he's not too far away either, just like you. So
Just a little ride.
Yep. Thank you.
Thank you, Manager Kitchen. Manager Matwani.
Thank you, Dr. Bell. I remember meeting Mike shortly after he joined Central Health, and it was back when I was at United Way, and this was back in 2017 or so, launching initiatives around social services that were more integrative and were looking at the social determinants of health. I think, earlier in the decade was when it was really becoming obvious that we needed to link social needs with clinical needs to look at long-term sort of global outcomes. And I saw this as an opportunity to be able to really kind of foster that nexus. And his chair wasn't even warm, and he didn't know everybody, in the social service world. But he came to United Way in a room full of 80 people, social service professionals from maybe 20 or 30 of the most active nonprofit social care organizations, spoke about the vision of Central Health, his personal commitments to improving outcomes. And I saw him and I said, wow, they really got a good suit. They pulled down a good suit for this job. And, as I got to know Mike, what I didn't know was with that suit, he brought, carpenter pants, knee pads, steel-toe boots, a full toolkit, and is ready to get into whatever trenches were required and whatever offices were required or whatever circumstances were required to move the needle forward in an organized, ethical, and earnest fashion. And I think that kind of leadership is what uniquely can motivate a staff and, again, inculcate a culture in an organization that allows an organization to, within 3 to 5 years, be in the midst of operationalizing such a brilliant and lofty plan, the Health Equity Initiative. And so I'm deeply appreciative of your excellent technical leadership and leadership by example. Mike, thank you so much for what you've done for all of us here at the organization. And, of course, the community members of Travis County.
Thank you, Manager Matwani. Manager Brinson?
I'm not sure I've ever worked with anyone as compassionate as you are. I mean, you bring the compassion home. You don't just talk compassion, but you live compassion. And it's really been an honor to know you. And I do hope that you will
Because we might not.
We might not be. Once he's gone, it's hard to say.
Thank you, Manager Prince and Manager Valadez.
Mike, I fought very hard for you. It cost a lot. Not in terms of heartbreak, and it cost a lot in terms of establishment of new values and practices in Central Health, because it needed a different perspective, and you provided it. You went out into the community. You were not afraid to meet anybody on their doorsteps and in their driveways and at their bus stops. And every time that I have asked for your help, you have willingly, enthusiastically provided it. So much so that you were there in the community when there were problems at the park, when there were homeless members that needed help. You made sure that your teams or the community care teams were there to help them. This is above and beyond Central Health suit-wearing responsibilities. This was community need and community assistance that you have provided. And so I'm very, very grateful for that which you provided, and which was lacking at Central Health. So you have moved the needle from where we were when I first came on this board in 2015, and I'm not ashamed to say that. I think I'm very proud of where we have, how far we've changed, how far we've come, but we still have a ways to go. And we would love to see you come back and forth, especially in helping to maneuver this new coming year and this upcoming decade for implementing the equity plan and bringing in at least two new, integral CEOs to our community, which would be, of course, the new CEO we're going to be having here to replace you, and then the new CEO that's going to be over at Integral Care that's going to be helping us to provide mental health and increase mental health services to our targeted population. So I just want to thank you for your service, your advocacy. Take care of yourself, take care of your family. And San Antonio is a great place to be. And there's a lot of need that needs to be filled in that community. I hope you resolve to help them in closing their disparities gaps, because they have them there also. Thank you.
Thank you, Manager Valadez. Manager Zamora, before I recognize you, can I recognize Manager Jones? Manager Jones?
Yes, Mike, I join in my colleagues in congratulating you on the opportunity to have, I won't say retired, but stepped away from that. Having gone through that experience myself, rest assured it is a pleasure. I want to focus particularly on some of the initiatives that you've helped us with, particularly the health equity and the development of clinics in the Eastern Crescent particularly. You were one of those who heard what we said and worked to get those things out there. I want to thank you for that. I want to wish you the best in your endeavors as you go forth, wherever you may be, and wish you and your family the best as you all change this part of your life to a different one. And God bless you and Godspeed as you move forward.
Thank you, Manager Jones. Manager Zamora.
Thank you, Chair. First of all, I want to apologize to the board and to Mike for being late, but there's a lot of sick people out there. It is about the patients. And Mike I've told that to you all and to Mike many times. Mike, you know how I feel about you. I love you like a brother. I love you like a friend. You know, you're an amazing man, and you've made us better by your leadership. Again, I got to thank you. I got to thank Dakota and your kids for your sharing your time with us. We'll miss you, but you have my number. I have your number. Thank you for your service.
Thank you, Dr. Zamora. Dr. Martin?
Yeah, I wanted to take the opportunity because I knew we're going to recognize you as well, Mike, and I wanted to actually thank you both very much for welcoming me onto the board and help nurturing me as the most inexperienced person in this gig, about your kindness and your patience, and I really do appreciate you. I wish you both a lot of good rest, and please stay in touch, okay? Thank you.
Thank you, Dr. Martin. I'll turn the floor over to you, Mr. Gieselin, if you have anything you'd like to say.
I was going to ask if I could abstain, but I realize I don't have voting privileges as staff, so I'll go ahead and swipe that one off the list. First of all, thank you all for the resolution and for the very kind words and for the privilege and honor of being able to serve in this capacity. If you would have asked me, at some point, let's just say 10 years ago, did I ever think I would be doing something like this? I knew it would be something in public service, but I wouldn't have picked this. But you all gave me a chance and the opportunity to come in and to fulfill a personal obligation to serve. But it's not lost on me that you could have chosen other people. And so again, I'm very grateful. I'm grateful for acknowledging the importance of family. I know Danica and I, that's front and center of our lives. And, you all have allowed me to take off from time to time, and just more recently, even be absent from a meeting. And so I'm very much appreciative of that because you don't get those days back. They're gone in a flash. And so that's meant so much to me. There's so many people in the community that I would really like to thank, but I'm not really sure where to start. And some of them I don't even know their names. But they would come through the drive-thrus for PPE, or they would be at a community event out in Colony Park, and we'd share a kind word, and have the opportunity to have a conversation about, how are you? And to have them share that experience, it really does put a new perspective on when you think about health equity and serving, what it means. And I think it's important because as big as we get and as complex as we are fast becoming, we can't lose sight of the individual staff person, the individual person that we serve. And there's a sea of people, but to be able to focus on one person and have that type of interaction and walk away so much wiser for the time. It's powerful, it's impactful, and it's really an opportunity to understand and to be educated in a way that you can't get in a classroom, and you can't get it by reading a book or reading something on a screen. And so I'm so thankful to all of those individuals that, probably not within earshot, but I send out the best of vibes and the best of heartfelt feelings to them for all the conversations that I've had over the years. And then lastly, the staff. And Manager Valdez, I hear what you're saying, but when I got here, what I found was a group of compassionate, hardworking, dedicated individuals, and it really did make my job easy because I just needed to come into work every day and flip on the light switch and push a couple of dominoes and then get out of the way. Because they really did know their craft and trade well. And when I look at everything that they've done over the past years, and I'm so thankful for the board establishing guidance each year. I didn't have to guess where we were headed. That also was a tremendous benefit to this job. But they understood this is what the board has adopted, and now this is what we're going to go do. And then the rest, as you can see, is history, which brings us to the present and being the leader in this county in building out a high-functioning safety net system. I give all of them the credit. Again, I just flipped on a light switch. The goodness, it was already here. It was here all along. And especially I want to thank Emily and Jackie for putting up with me. I mean, it is, our family calendar is an absolute mess and a wreck, and you had to deal with it, and you had to deal with me moving things around, and just as soon as I get the scheduling rules set, it's like, you know what, I thought about this, let's do something different. And so, but you all pivoted with me every step of the way, and so I wish Emily was here, unless she's walked in and sitting behind me, I don't see her, but a special thank you to the two of you. So, very kind words, and thank you.
Thank you very much, Mr. Giesland. I'd like to call the question. All in favor of the resolution?
Aye.
Any opposed? Any abstaining? Resolution passes unanimously. And before I come off of this agenda item, I think it's really fitting to sort of hear all of the board's comments with regard to Mike. I was at the Hornsby Bend grand opening, and my fellow board member, Ram, whispered in my ear, Mike has a knack of being able to talk to people, listen to people, and engage people. And so, why don't we dedicate a conference room to Mike Giesland? And so, with that, the staff had no problems taking care of that for us. And I think it just outlines what a great person and a person who can bring people together and engage people and listen to them and bring their ideas into the conversation. And so, congratulations, Mike. And I truly thought that was the perfect idea, and I will let Dr. Maram say a few words.
No, I think our chair said it perfectly. Just want your legacy to continue on within Central Health, and you were an essential component to the establishment of those clinics. You personally met with the owners before it was inception, and you had those one-on-one personal conversations, and you brought their vision to life and the vision of our community. And we hope that your voice continues on, and your legacy of listening and hearing your compassion will continue throughout. Thank you.
Did you have something? No, I was just going to say we need a picture. Yes, well, we're gonna sort of stand for pictures. I think we have all the other formalities out of the way.
We're gonna have one together.
Yeah, everybody.
With Mike.
I would have been content with like one of the refrigerators in the break room.
And a man,
Yeah,
a refrigerator.
maybe like a 1-year extended warranty, but this is, wow, this is unbelievable.
I'm coming.
Yeah.
Ready? 1, 2, right, look at me. Okay, now look. Professional, they go.
Right here. Okay, now on 3, 1, 2. Got it.
Thank you, Mr. Giesland.
Okay, managers. On to our next item, agenda item number 4. Approve the candidate recommendations made by the Ad hoc Board Officer Nominations Committee for the following officer positions and elect the recommended candidates for the calendar years 2024 and 2025. A, Chairperson Manager Ann Kitchen. B, Vice Chairperson Manager Cynthia Brinson. And C, Treasurer Manager Maram Musaitif. Managers, as the stated nominations committee recommended above, the above slate, and we actually had some very diligent and long deliberation to get to this point. However, for this slate, if elected, to remain consistent with our bylaws, a 2/3 vote of the board members, that will be 6 members of the entire board, will need to pass a motion to waive the bylaws limitations for any member to serve 2 consecutive terms. So before taking up the election of officers and approval of the slate, I will ask for a motion to allow the waiver of the term limitations for Manager Brinson to serve as the position of vice chair, and after that, for Manager Musaitif. So, do I have a motion, Manager Kitchen?
I move that the board waive the term limitation of section 6.8 of the Central Health Bylaws to allow Manager Brinson to serve as vice chair.
And do I have a second? I have a second from Manager Zamora. So I have a motion from Manager Kitchen, a second from Manager Zamora. Any further discussion? Hearing none, all in favor?
Aye.
Aye.
Any opposed? I have 1 opposed, show Manager Musaitif opposing, and any abstaining. I have 1 abstention, Manager Valadez. David?
Shannon.
Oh, and Shannon, you abstaining? Yes. So, what do I have?
That's 6.
Okay. Then the motion carries. All right. Although the term limitation may not apply to Manager Musaitif because she completed Manager Zuniga's term as treasurer, to cover any possible legal interpretation, I will ask for a motion to allow the waiver of the term limitation for Manager Musaitif to serve as the position of treasurer. Do I have a motion, Manager Kitchen?
I move that the board waive the term limitation of section 6.8 of the Central Health Bylaws to allow Manager Musaitif to serve as treasurer.
Do I have a second? Manager Martin. I have a motion from Manager Kitchen. I have a second from Manager Martin. Any further discussion? Hearing none, all in favor?
Aye.
Aye.
Any opposed?
That was an aye.
It was an aye, okay.
I apologize.
I never know nowadays, you know? And any abstaining? So I have 1 abstention from Manager Musaitif. Oh, I have 3 abstentions. Manager Jones, Manager Valadez, and Manager Musaitif. The motion carries. All right, since the waiver has been approved, I would now like to ask if there are any additional nominations for any of the officers on the current slate for chair, vice chair, or treasurer. And this time I'm going to make sure I look around to everybody. Okay, hearing no additional nominations, unless there are any objections, I'd like to accept the slate of candidates by acclamation. Chair, Manager Kitchen, Vice Chair, Manager Brinson, and Treasurer, Manager Musaitif. Hearing no objections? Oh, you object?
So does that mean that you're not going to take a vote for abstentions or opposition?
That is correct.
Okay, then I'm
Okay. Based on the objection from Manager Valadez regarding the exception of the entire slate, I will now take each position and ask for a vote on that position for to be elected. So, on chairperson, I need a motion. Manager Musaitif?
Chair, I move
I'm
that.
sorry.
You don't need a motion. You just vote. It's not a motion, it's a nomination. They're already nominated. You don't need a motion at all. Sorry.
Okay, well.
Just following Roberts.
that-
That's what Robert says. A
I
nomination.
understand, but you wrote motion. That's the only reason I'm doing it. All right? I'm following you to the word. All right? All right.
Apologies.
So, for chairperson, Manager Kitchen, all in favor? And any opposed? Any abstaining? Manager Valadez abstains. Vice Chairperson, Cynthia Brinson, all voting? Any opposition? Any abstaining? I have 2 abstentions, Manager Musaitif and Manager Valadez. On Treasurer, Maram Musaitif, all voting? Any opposed? Any abstaining? Show Manager Musaitif and Manager Jones. Excuse me. Show Manager Valadez and Manager Jones abstaining. And Manager Jones, did you abstain on any of the other votes? Because I may not have looked up there.
No.
No. Okay. Thank you. All right. Congratulations to Manager Kitchen, Manager Brinson, and Manager Musaitif. All right. Agenda item number 5. Approve the recommendation by the Ad hoc Board Officer Nominations Committee regarding the Board Secretary position and appoint Dr. Manuel Martin as Board Secretary for calendar years 2024, 2025. Managers, since there's only one nomination, I will accept if there are no objections, I would like to accept the slate for secretary by acclamation.
You have to ask for if there are any additional.
Are there any additional nominations? Hearing none. Dr. Martin, by acclamation, you object?
I'm abstaining.
No. You had to object to my acclamation, which you did. Okay, so now we will vote. Members, on the nomination of Dr. Martin as Board Secretary, vote. Okay, and any opposition, any abstentions? Show Manager Valadez and Manager Jones abstaining. Okay. Agenda item number 6. Oh, congratulations. Agenda item number 6, discuss and take appropriate action on updates to procurement policies. Jeff Knodel and John Morgan will be presenting. Welcome, guys.
Thank you, Dr. Bell. And good evening, managers. As has been recognized earlier this evening on a few occasions, Central Health continues to grow and evolve, both in size and complexity and the scope of our work. I don't think there's a single function or position or department in the organization that isn't evolving and pivoting and fortunately all coming together to really get behind the mission and strategy and the direction that this board has laid out for us. The agenda item we have for you tonight is some recommendations updating our purchasing policies as one of those things that also needs to evolve as the organization does. Next slide, please. Particularly as we have expanded into the direct practice space, Jeff and I are presenting tonight a few updates to the purchasing policies and the delegations of authority that are in some of those policies. And really these recommendations are driving towards trying to mitigate risks associated with direct care delivery. These are risks that we really haven't had over the past 20 years, and when we're caring for patients in central health environments with central health care teams, that's a different level of responsibility, a different level of involvement, and as a result, we need to ask the board tonight to consider some changes that help us as your leadership team mitigate those risks and take actions when we have unforeseen circumstances. I'll give you just a few examples that I think came to mind for me immediately. There's a long list of things, but when we talk about running clinical operations, we can have a piece of major medical equipment that goes down unexpectedly, even though we're going to plan for that longer-term capital planning and replacement and replenishment of our equipment over time. You can't always anticipate when our echo is going to go down, or our ultrasound is going to go down, or our mammography unit is going to go down, and we really want to have the ability to take action as quickly as possible so that we can mitigate interruptions in care. We could have something like the COVID pandemic come along, where we need to be able to procure PPE for our teams in a hurry, things that again weren't necessarily anticipated. We could have vandalism, theft. We can have cold weather emergencies that come up. We can have power outages. Our network equipment, our IT equipment can go down. And what you'll see here is our attempt to have certain officers slightly increased authority for purchasing and for executing contracts, again, with the ability to mitigate those interruptions in care for our patients. Some of the recommendations that you'll see, and Jeff will go into a little bit more detail, but we are aligning our procurement policies with those of our enterprise partners. When we're on the same system and not multiple iterations or multiple versions of similar systems, there are efficiencies, there are cost savings associated with that. That applies to equipment, not having different types of ultrasounds in the central health environment than we have in the community care environment, for example. We really have to standardize what types of third-party vendors we're working with that integrate with our EHR, since we're on a shared instance, and many other examples. We are asking the board to increase the delegation of authority to our CEO and our incoming CEO, again with the notion, I think someone said earlier today, that $100,000 isn't what it used to be, and that's where that level is currently set, especially considering the costs of some of the equipment, the service contracts, professional services agreements that we may need to execute in a hurry. And these are for the things that aren't specifically contemplated in our annual budget process. We have similar increases in purchasing delegation authority to myself, to our CFO, and to our CIO for those different examples that I was speaking to a minute ago. And then we've recommended creating an additional mechanism or two. One is what you'll see is a dual approval process, so that for those that delegated authority, two of us have to make the approval to execute those types of agreements or purchases, where in the past it's only been one of us, as well as creating some additional reporting back to the board when the circumstances necessitate us taking that action. Next slide, please. Yeah, so I'll go through some specifics. I would add to what John was mentioning, some specific examples. I will mention some examples that we don't know that we don't know. For example, we didn't know that we would have auto incidents with our Southeast Health and Wellness Center twice. We don't know if we've had instances where internet or power has been temporarily suspended or cut off, and it may entail us making some really quick mitigation actions to continue to provide care. And so I think it echoes with me what John is saying, is that we're really are moving into a different environment of direct patient care, that we have the responsibilities to provide the care, whatever the circumstance may be, and so staff feel like it's time to evaluate our policies, and so we're making these recommended changes to take those into consideration. I'll also add that these are recommendations that we feel are pertinent. There's always the ability in a future date to revise policies. This does not lock the board in the future to come back and potentially make other revisions. So that's always an option also. So we're talking about, somehow we skipped to, yeah, there we go. So we're really talking about two policies. So the first policy is really a more general procurement policy. And there really are a couple of language cleanup revisions that are being proposed. I believe we had the red line in the packet that was sent out Monday, I believe. So just quickly going through, John mentioned the ability to, as an enterprise, to be able to leverage our affiliate, or our what really are called component units, being Community Care, Sendero, and Community Care Collaborative, to be able to, as we become more of an enterprise and share some of the systems, that we have the ability to purchase some of those common or shared either services or products amongst us. So we're redefining what a related organization is to specifically as a component unit. We're also defining the chief executive officer. There's some revisions in there that articulate the chief executive officer, but also to include acting and interim CEO, to include that said authority within the policy for those positions. And then again, just kind of going through other updates. Again, we're updating the definition of the partner from affiliate to component units. We're updating the hub definition just to comply with our more general procurement policies. And then we're adding goods as purchases exempt from competitive bidding process. So right now, professional services are exempt. Goods are part of what we provide to patient care. We feel like there may, in some instances, be some exceptions that we may need, what we would call goods or non-services as it relates to patient care. And the way we're defining it in the policy, that it's goods that would be exempt, that if we weren't able to procure them, they would negatively impact patient care. So that's the first policy that we're proposing amendments to. We'll go to the next slide.
Jeff, prior to
Yes.
going, she has a specific question on that.
Hi, Jeff. Thank you for doing this, but I'd like to know whether or not you have the proposed changes in that format. That's not the way we received them, and it makes it, that is much easier to read. It's more readable, it's more succinct, and it gets us, I can understand, or I would think it's easier to understand the scope of the changes that you're proposing. If we could have a copy of that. Is that the same format that you're using for the additional policies?
Yeah, yes, ma'am.
Could we have a
And
copy of that?
There's only one more.
Because we don't have a copy of that. What we have is this,
Okay, the actual policy, okay.
yeah.
Yeah, okay. We will, I'm gonna go ahead and keep going.
Yeah, please
Yes,
keep
please,
going.
I appreciate
I think we
it.
have,
Thank you very
I
much.
think we have it on the printer on the way, so. Thank you. So the second policy is the delegation of purchasing duties, and you'll see some of the same type of potential revisions around the CEO definition. And this is the policy where we're requesting the CEO authorization of administrative authority to be increased from $100,000 to $500,000. And then, as John mentioned, we're also requesting additional authority around certain officers in central health. And so let me read through that. The first one would increase contract execution authority of the chief operating officer from $100,000 to $200,000. The second change would increase contract execution authority of the CFO and CIO from $50,000 to $100,000. And then, as John mentioned, another requirement is the requiring 2 of the 3 delegated officers to approve the contract authority. So it would, of the 3, 2 would have to approve that contract execution. And then last, related to the administrative authority, any execution that's above $250,000 that was that authority was utilized, there's a reporting requirement that at the next the next available budget finance committee meeting, that would be conveyed or communicated to the budget and finance committee that authority was invoked. So in a nutshell, that's kind of the 2 policies that we're recommending amendments to. We'll be happy to answer any questions or receive any comments or input related around these proposed amendments.
Thank you very much, Jeff. I appreciate it. Any questions, Manager Musaiti?
Thank you for the presentation. I have a comment related to requires reporting to the Budget and Finance Committee if anything greater than $250,000. Why is that amount? And I think it's relatively high. So can we drop it down? Because I just don't feel comfortable with that amount of money authorization. I don't know if other members also agree with me.
Manager Martin?
I a similar question. I mean, how did that number get arrived at, number one? And number two, does the CEO also need to get another delegated officer to spend money? Or is he just can function independently?
Today, that's a delegation that you all have given the CEO. It's just at $100,000 today.
Right.
But we in this policy, we did not include a secondary approval for the CEO. Okay. That was really the intent behind that check, was that if, the authority going up to $500,000, but if there's an expenditure of $250,000 or more that was not contemplated in our annual budget, then the CEO or staff would bring that to the next Budget and Finance Committee meeting for awareness of the board that action was taken.
Right, so I guess the question is, how did that number get arrived at also roughly? I know it's 100,000 is not 100,000 anymore, but some rough idea why that number?
We didn't think that 500,000 was the appropriate number. And I'll say, I think some of the delegation here, not just to the CEO, but to us and as the executive team, Mike has been very gracious with his time with us. And right now, you know, a lot of the number of contracts that we have in this organization has doubled or maybe even tripled in Mike's time here. And right now, almost every one of those goes to Mike's desk. And I think it's appropriate for some of us in certain officer positions to share in some of that responsibility when we are closer to the work. But again, trying to figure out what the right level is and where the board's comfortable with that.
Manager Valadez?
So my question is going to go, is there an urgency for passing these policy changes today? Is this something that we can get a better look at other than receiving them right now, or, I mean, within the last 2 days? Is this something we can put off till next year? At a point in time when we are actually providing direct services? Because I think that really moving these numbers, increasing them by such a significant amount, without some real justification for that, and how we arrived, again, echoing Maram and Dr. Martin's concerns, how we arrived at those numbers. And not only that, how often do we think that this is going to actually occur? And then you have to understand, I'm a little bit shy of approving increased amounts of money without appropriate fiscal reporting. And then at least the next, like I said, the next bit, like you said earlier, Jeff, the next immediate meeting letting us know why we needed to do that. Because I'm still shell-shocked about the UT responses. So I don't want to see us enter into other contracts without having some justification for why we need to do certain things, why language is being put in place without being questioned. And so I prefer to hold this off until next month, if at all possible, unless there's some urgent need. And if so, then we would need to be dealing with this on an emergency basis. But I don't feel very comfortable supporting any change today. That's the only reason I'm asking this.
Mr. Morgan?
Yeah, thank you, Dr. Bell. And Manager Valadez, I mean, the board certainly does not have to take action.
No.
We have a policy that's in place today. I think we are recommending that you all take action today, though, based on the fact that we are already practicing medicine in multiple locations, multiple service areas, with another coming online in January. I think the preparedness of the organization in terms of practice of medicine going into colder months is maybe not a critical timing, but I think we do feel a sense of urgency around that. And I think with Mike's departure and not having a defined timeline for an incoming CEO is also driving a little bit of our urgency to have some of these procedures put in place. And again, we can always come back and adjust them in either direction at a future board meeting as well.
I understand that, but if we were looking at, if you were assuming and telling us that there is a need because we are now practicing medicine, then at the point in time when we began to practice medicine, why were we not asked to implement such changes to the policies of Central Health?
So that's all happened within the past year, with the exception of our surgical podiatry work that's in other facilities. So this build is certainly a work in progress. I mean, I'm certainly happy to take responsibility for this coming to you at this point and not sooner. I think we felt like it was a necessary change and wanted to bring it forward for consideration.
I understand, thank you.
Mr. Geisler?
Yes, so to echo what John just said, as we're working through these processes and, it becomes obvious that something needs to be put forward sooner rather than later. And it's, to try to wind back the clock and say, okay, would you have been able to come up with this policy change at the time that we had the legislation passed? We might have, but it would have been premature to put it forward at that time too. Second, and if I could just opine on this, and I haven't checked in with staff folks yet, but the most important thing on here is really the contract execution authority for the COO and the CFO. The CEO piece could certainly wait, and so there's different ways to do this. I wouldn't recommend striking it, but what I would recommend is that you could actually put a delayed effective clause on it to say effective June 1, 2024, if you feel like you need some more time on this. Or you could strike it, but again, I just want to emphasize the importance of the COO and the CFO changes. Lastly, I do think that there is a kind of a rough process map, and this is a short timer creating more work, which is always enjoyable, but to have a process map that the board can see, there are several controls before a contract ever gets to my desk. It passes through a lot of different hands and desks, and legal eyes have to be put on it. Otherwise, it doesn't get to me. Like, the system is set up. No one can bring me a contract and just put it on my desk and say, here, sign this. And I think to give the board some comfort that we've got those controls in place might help as well.
Yes, Manager Valadez.
Very quickly, Mike. Michael? Thank you. When we voted to create the Medical Advisory Committee, I think that there should have been a discussion by that committee to talk about these prospective changes to our policies, and just my opinion, and then present them to us in a fashion where we would have been better prepared and more informed to act within that reasonable necessary time period. And again, I'm just going to say this is my opinion only, but that's a lot of money that can be spent within, at the signature or at the request of one person. And I just need to think, I think we need to talk about the process and the justification. And I'd like to hear what the medical advisory committee recommends, since they're I think mostly doctors that are operating in the provision of services world. And they could tell us honestly whether or not these are things that they may need to have in place, especially since they may have had hospital experience and or hospital administrative experience, and then that would be maybe more understandable by a layperson. But other than that, I just think asking for us to approve these changes right now is, it's your prerogative. But I just want you to understand that I have to voice that. Thank you.
Thank you. Manager Jones? And then I'll get to you, Manager Martwani and Manager Kitchen.
Yes, thanks very much. I have some of the same concerns that was raised by the other managers as well, but I also understand the rationale why you want to do this. I guess the timing is a big issue. My question goes to, have we looked at practices in terms of these positions at other hospital districts and their level of authority for granting these type of requests and part of the modeling, or is this something we independently said this is what meets our needs, and that's why we're recommending those?
Manager Jones, I'll start, and certainly Jeff can add to it, but I think what we've tried to make these dollar amounts in our recommendation based on were some of the specific types of scenarios that we think we could encounter. I mentioned some of those in kind of my opening comments, but I'll give another example that if we have a power outage and our alert system doesn't tell us, and we have a failure in that system, we could lose all of our vaccines that are in our refrigerator in our clinic. And replacing vaccines is not a $100,000 and less exercise. Those are quite costly to replenish that. And again, we don't have to do it through this mechanism. We may just go without until we can bring an item back to the board, or an emergency meeting of the board, I think, is another option that you all have. But I think we're trying to, again, approach this with minimizing those disruptions as much as possible, but that needs to be within the comfort level of the Board of Managers.
And I'll follow you there. I so agree with Mr. Giesland on the COO and CFO. I could understand that being now the CEO being new, coming in. I think the person we would certainly want that individual to have a comfort level themselves in coming in and being able to have seen something like that. And I don't know if it's consistent from hospital districts to others. It's just something unique. So those are the concerns I have, but I appreciate your response.
Thank you, sir.
Thank you, Manager Jones. Manager Motwani?
I'll start by saying that I feel like Jeff is one of the more conservative CFOs that I've known, and that's already saying a lot. I mean, just among CFOs, right? And that provides me with the level of comfort to match some of the heartburn that I share with the other managers who've spoken. And I think this has been really thoughtfully and carefully presented to us, and I really appreciate you all drawing out the distinctions. Also, I echo that I'm certainly comfortable with the CFO and COO changes. I think some of the concerns that we may be trying to solve for may inadvertently be also the kinds of circumstances that we want to control for, meaning perhaps the absence of a CEO might be the kind of circumstance where we may want to be more aware of what's going on so that we can act nimbly, as opposed to maybe acting nimbly without being more aware of what's going on. So I would definitely feel better about maybe backstepping on the CEO amount, or perhaps revisiting what the controls might look like. And also, when it comes to the reporting amount, wanted to dig in a little bit and see if the reporting burden is, if I can get a sense of what that burden is, say between, of reporting to Budget and Finance Committee, and whether or not changing that really resolves a substantial lift or not, or whether we could leave that as is. Again, just when we're considering the controls, I think the managers are discussing. And then finally, sort of in the vein of what Manager Valadez is asking, if we may be able to revisit this, contextualized maybe by a sense of other best practices. And I know that you all, being experts in your respective areas, are swimming in context of best practice, but if we may be able to have some context around maybe what other organizations may be doing, or similar organizations, uniquely with similar budget turnover and expenses as we have, that would help me a lot. But prima facie, when it comes to the COO and CFO amount increases, I'm comfortable with those. Everywhere else, I think maybe backstepping in a little bit of context around other best practices would be helpful. But to be very clear, I do agree that this needs to occur, and just looking at orders of scale when it comes to our budget, turnover, and expenses, it makes sense that at minimum there would be a proportional increase on the proportional to expense increases, but I think we should probably go beyond that, just given notions of inflation and otherwise. Thank y'all.
Thank you, Manager Motwani. Manager Kitchen?
I have a question. So on the reporting back to the Budget and Finance Committee, And looking, is there an amount set right now?
That function does not exist today.
Okay.
But the CEO and staff can certainly bring back informational items. CEO can do that at any time.
But it's not required at the moment.
It is not a current requirement, so
Okay.
we were adding that.
It's just FYI, it's not underlined in the that's the reason I was asking. So just yeah. So I couldn't quite tell whether it was new or not. So so is the whole concept is new, not the amount, if I'm understanding correctly. Is that right?
I believe the last sentence of the paragraph you're referencing, Manager Kitchen, is new.
Okay, that sentence, okay.
I believe the rest of that,
So it's just that last sentence, that makes sense.
Yes, ma'am.
Okay. All right, so, so my thought is, I'm hearing the concerns that everybody's raising and agreeing with them, and so I would be prepared to move forward today if, if people wanted to, with the change for the CIO and the CFO, and then hold off on the other changes. Except that I would also be, well, I guess we wouldn't need that new sentence if we were going to hold off on the other things. Okay. I would be fine with moving forward with the change for the CIO and the CFO, and then delaying the rest of the changes. So happy to make a motion if that's appropriate.
Can I ask, does that include the COO that you're including or excluding?
I personally am okay with the COO. I'm not remembering if people commented on that.
Okay, so we're, as far as the officers, there's the COO to 200,000.
Yeah.
And the CIO and CFO to 100,000.
Right.
So what I think you're saying is you're comfortable with that?
Mm-hmm.
And,
I do.
And there may be some discussion as to the CEO.
I think the CEO, I think the additional information that people have been suggesting would be important for us to hear. And so waiting until our next meeting perhaps would be appropriate from my perspective to hear the additional information that people want. I also do think it would be important, and I'd like to hear from Manager Musaidov, but that the 250 I think is too high, is not the right bar to set, in terms of reporting back to the Board of Managers at the Budget and Finance Committee.
Manager Martin, and then Manager Musaid.
Thank you. I'd like to voice actually support for this, and I'm not opposed to getting it to everyone, including the CEO. What I would like to do is perhaps lower the bar, the reporting back to the Finance and Budget Committee, because these are going to be emergency expenditures. These are not run-of-the-mill things. So to say we had an echo go out and 2 ultrasound machines go out and 3 colonoscopes got stolen, we had spent $200,000. I mean, I think that bringing perhaps having the bar lower set to bring that data to us to review, and not having us dig into the minutia of overlooking everything to some extent. I'm not opposed to the numbers. I just want us to have more accountability that data can be brought to us, because these are not going to occur on a monthly basis, I would hope. But to come and say, the vaccines all died and we need $500,000, that's something you have to spend $50,000. I mean, I just would suggest that bar should be lowered to presentation, as long as, and I would leave these limits as they are. I'm not opposed to inflation and medical expenses, and medical things are very, very expensive now, so that's all.
Thank you. Manager Musaid, and then Manager Valid.
So I like that idea, Manager Martin. And if we can lower, I'm just thinking the proposed is 250, maybe 100 to 150. I think that is probably appropriate if it can alert us if there is an emergency, what we need to expend. So in terms also transparency to us in the community. So I'm comfortable within that range, whatever y'all recommend, and I can support it if we can lower that amount.
Thank you, Manager Musaid. Manager Valid.
Yes, and I would be amenable to doing something similar. However, I want to be assured that we're talking about the purchase of of equipment, medical equipment specific to and necessary for the provision of medical care of our patients. I'm not amenable to professional services or outside legal counsel or, whatever. I think if we want to look at what we think or what we believe is best for the provision of high quality medical care, then it should be for that equipment. It shouldn't be for anything else. And the only reason I say that is because I want to make sure that we're protecting ourselves as Central Health from some misunderstanding or a misstep that might occur with respect to a budgeted amount now being increased without having to go to at least the board to know why it's necessary and why we're doing this without, I guess, reasonable justification. So I'm referring to equipment.
Dr. Bell, if I may.
Yeah.
Unless we're bringing in a doctor, a specialist.
So I think we're trying to approach the problem in a similar fashion, but I want to caution against limiting to just equipment. Again, this could be vaccines. This could be we have an incident at a clinic and need to have more on-site security. It could be, right now, we have one gastroenterologist in our practice. And if that gastroenterologist has to go out unexpectedly, we are going to be faced with the choice of either canceling patients or finding a locum provider that can fill in on a temporary basis. And we're trying to preserve access and patient care, but I completely understand your
because I used to live in a gastroenterology unit with my daughter. So I understand that the importance and significance of you using that example. However, what I'm referring to, I guess, and the overall understanding or overarching understanding is for the care of the patient. This is necessary. That's what I think the language should be. I guess I'm trying to convey that for the necessary care, medical care of our patients, this was necessary for us to do. This piece of equipment was necessary for us to buy. These goods, vaccines or whatever, was necessary for us to have in order for us to be able to conduct the practice of medicine and care for the quality of life of our patient. That's what I'm referring to.
Yes, ma'am. And
Thank you.
If I may, just to clarify, so the language that we are editing in that policy, it already included purchases of services that are critical to Central Health's operations that if not secured immediately will have severe impact, impair, or completely inhibit such operations. What we've added are goods so that it's not limited just to services. And we've added that or otherwise will negatively impact patient care because that wasn't contemplated in the prior policy.
Thank you.
Yes, ma'am.
Dr. Zamora.
As the chair of the medical committee, if it's the will of the committee, as a board, to take it up, we can have an early meeting next month in January and discuss this. So we can bring this back to the board before another month goes by, because John and Jeff are correct. I mean, these things do go out. They're expensive. Equipment's expensive. So they do need to have the funds available to them. They're not going to take the funds and keep them in their pocket. But I'd be happy to call a special call meeting of the medical board. If it's okay with my staff members.
I think listening to the concerns of the members, I just spoke with Maram. If there is a motion that can be put forward that picks out those issues that you guys don't have a problem with, and then bring the other issues back to Budget and Finance next month, that might solve this issue so that we don't have to have a special meeting during the holidays.
Would that be with the inclusion of the Medical Executive Committee's justification for that?
The
Like
medical
Dr. Zamora
executive,
ordered.
medical executive committee is up to Dr. Zamora if he wants to call a meeting. with regard to that, but this is more of a budget issue than it is, Dr. Zamora's.
Sure, no, the only reason I brought it up was, if the will of the board is for the medical executive committee to evaluate this, I'll be happy to call a special meeting.
Sure,
But you're right, it is a budget and finance committee.
Hold on. Are you gonna make a motion or no?
Well, based on what I'm hearing, the census, I think we're all in agreement. But what comes back to the Budget and Finance Committee, your proposal is 250K. So my motion will be to modify that to, are you all comfortable with 100 or 150? Just whatever number between that, and that's the motion that I present.
But the other changes would be accepted?
Yes, all changes will be accepted.
Okay.
Did you say all changes?
Yes,
CEO down?
correct.
If I could possibly be amenable to that, I think if we accept all changes, I think the number for budget and finance should be the lowest one that you're considering, if
So
that's the case.
100K. So I think,
I think the higher this number, the lower this number, to Dr. Martin's point.
okay, so my amendment would be to,
Your motion.
sorry, my motion would be for that amount to come back to Budget and Finance to 100,000 rather than 250, and to approve all above. Because I think that would answer all our questions and concerns.
So,
And if I could just comment, I didn't comment, I think you were asking about a reporting requirement. So I do agree with Dr. Martin. I don't think this is going to be a real frequent occurrence, and it's not a reporting burden. If you'd like to lower it to 100,000, that's not going to be an overly burdensome reporting process.
So we'll stick with 100.
Manager Kitchen.
Just an informational item. I'd like to ask ask if we could also, at the Budget and Finance Committee, just be informed on what the process is for the CEO. I think you mentioned it, Mike, that there's, I forget what term you use, but the process that has to go through before the CEO would even be able to approve. So those checks and balances would be important for us to understand.
Understood. Brianna, can you add that to our next agenda item? Thank you.
So for clarification purposes, Ann, you're talking about procedural. A procedural modification. Thank you.
I'm just wanting to understand what exists right now. Mm-hmm.
Yeah.
Manager Martinelli.
Dr. Bell, should, and, or maybe I can ask y'all, is there a consideration or is around deputy CEO and procurement authority there? And or is what is there any consideration around that? I mean, I'm sure that we're intentional about the documents that we're looking at, but I'm just curious.
Yes, and that was, one of the changes was to just clarify some of the language around the CEO to ensure that if you all were to name an acting or an interim, the deputy CEO, the deputy administrator or assistant administrator, Perla, assumes the role of the CEO in the CEO's absence. So that I think is already in place related to the bylaws that are there today, but you'll please correct me if I'm wrong.
No, it is correct. And we also added the definition that we modified in these documents makes it clear that should the CEO and the deputy administrator be out, that anyone they designate is also, if you're an acting CEO, they get the CEO's authority while they're acting.
So, would you like to make the final motion? In essence, what I'm hearing is that the board wants to approve the revisions with some exceptions, and you need to outline what those exceptions are. Is that correct?
Yes.
So,
I think the only exception is just
Well, it has to be in the motion because, yeah, okay. So if that's the only exception,
so Chair, the motion is to approve what the policy presented to us with modifying the amount that comes back to the Budget and Finance Committee to 100,000 rather than 250,000. So that is the motion on the table.
Okay, do I have a second for that motion? Manager Martin, seconds the motion. Any further discussion? Hearing none, all in favor?
Aye.
Any opposed? Any abstaining? Motion carries. All right, thank you guys, appreciate it. Sure.
Really, a question for legal counsel, because all the aforementioned occurring discussion was on policy PUR 1-005. But was there a sufficient motion made for purchasing policy 1-001?
That
Because
was,
there's actually two different.
yeah, the intent of the motion was both policies, just changing
Okay.
05. Yes, I think
Okay.
that's sufficient. Yes,
Thank you.
because that was the
Thank you.
standard motion with just a correction.
You okay?
All right, thank you.
Okay, agenda item number 7, receive training on open government statutes. David Duncan, Hasib Abdullah of Travis County Attorney's Office will be presenting.
I have to get back to my presentation. My PowerPoint. There it is. There we go. I'll kick us off. Go ahead and go to the second page. That's just a cover page. And I'll just get us started. This is something that's not required by the statutes, not required by your bylaws, but we were asked to do this some years ago by Drs. Moore and Chair Greenberg. And what we like to do is just sort of give you a working overview of the two acts, the Open Meetings Act and the Public Information Act, and really focus on those portions that are most relevant to you in your role as a board manager. And also cover recent developments in the act. I'll tell you on that, in this session, they hardly did anything. In the last session, they made numerous attempts to try to codify what was going on during COVID, which would have made a lot of us very happy that you could have fully remote meetings, for example. But those all failed. One of them got kind of close, but didn't make it through. So there are not a lot of recent developments. And with that, I'll hand it over to my colleague Hasib, who will do the Public Information Act.
Okay, thanks, David. Hasib Abdullah, Travis County Attorney's Office. Be really short because I know the night is quite late. The Public Information Act is housed in the Texas Government Code, Chapter 552, which allows the public access to records that any public entity has in its possession or has the right of access to. So that could mean even not just written records, that could mean also audio recordings. And usually that has to be provided within 10 days. There's a lot of exceptions to that, but that shows you the timeline that's really pressing whenever these requests come in. A PIA request does need to be in writing, but if a PIA request comes to you in any form that you think may be a PIA request, please get with Central Health staff or us, and we'll be able to help you decide, what the next step is. Brianna Yanis, who's very knows this better than most of the attorneys who handle open records, which can help you with that, or Perla Cavazos and some others. But we really definitely need to get that done, or get that ball moving quickly, because Travis County Attorney's Office, we have our own office that actually handles open records as well. So there's a lot of exceptions. I'm not going to go into them, but like sometimes you have to get those things to AG opinions, or AG, Texas AG for exceptions and such. Please remember that anything written and recorded that deals with Central Health may be considered Public Information Act. So if you have your own emails that you're sending text or emails even with your private emails, that could also be subject to the PIA. And further, it may be a situation where Central Health staff or the Texas or the Travis County Attorney's Office may ask you to go through your private emails and text to see if there's anything that actually pertains to it. So just keep that in mind, that anything written is subject to the PA potentially. And there are a lot of exceptions, but again, that's something, just let us know what, just please be as responsive as possible. I would say that sometimes, that's why there is, I think, a Central Health email that all of you are given, so that's always sometimes a idea to think about, instead of just using your private email. Sometimes it's one place, so that's easier to look through. Lastly, I'll just say that please remember Texas is very serious about the PIAs, and potentially it's pretty rare, but sometimes you can have even criminal penalties for not providing it or manipulating in some way. And so that I would just ask you to see how Texas is, how serious it is, and that's so it's really, really important to, make it a priority. So that's all I have right now. If you have any questions for Tralisha, David, Brianna, or myself, ask us anytime. But otherwise, that's all I have for PIA for right now.
Any questions, Manager Valdez?
So is that it for all this? This is just for our edification?
Yeah, it is.
Okay, great.
But there's David has some too as well.
Yeah.
Oh,
I'm not
Keep it short.
then I'll wait
We're trying
until
to be summary
the
here.
complete
Yeah.
presentation is over.
We welcome any questions when we're done. But
I'll wait.
We'll try to finish up really quick. So I'm going to do the Open Meetings Act. Anytime you have a quorum, and it's a quorum of a committee or a quorum of the board, we have to do notice, and it's subject to the act. You have to take votes in public always. There are some rare exceptions in the act about taking votes in closed session, but none of those apply to us. Something that was a change not too terribly long ago was a requirement that you allow public comment, but the Central Health Board has always allowed public comment, so that wasn't a big change for us. Change next. Thank you. The quorum is a majority of the members by statute, so a quorum of this board, and again, I'm not going to get into the details of a remote meeting and ability to participate by remote meeting, but basically you have to have a quorum physically present at the location where you notice the meeting. So that's a minimum of 5 for this board, 3 for basically all of our committees. And the kind of subtler portion of that is, sometimes y'all see we notice when you all went to the grand opening, we noticed that as what we call a quorum event. It's not a meeting, but we tell the public, hey, all of our members might be at this location. We don't expect them to do anything, and there's no posted items. There's no specific item for deliberation. And that's out of an abundance of caution. And what really drives that, it's sort of twofold. If there's a quorum and you're going to talk about or do something that is related to your business, that's one thing. And then the other one is, it's a quorum and we're kind of causing everybody to go. So you may have seen, we don't often post, like when you go and listen to the Commissioners Court presentations, we don't necessarily post that because it's not necessarily you're doing that, you're kind of being summoned to something. So it's a bit of an art form to decide what of those quorum postings need to be posted or not. Deliberation is pretty common sense. It's basically anything you do that relates to the work that you do, any kind of verbal or written exchange. It includes staff briefings. Before they changed the law to make this clear, a lot of state agencies were doing staff briefings behind closed doors where they swore only the staff talked, the board never talked, they just listened. And the legislature said, no, that's not, nobody is watching that. So they decided that was not wise. Now, there are things that are defined as not a meeting and attendance at a social function. So if you all are invited to an open house at the Dell Medical Center, we didn't post it. It's not our doing. It's not our business per se. And so you guys can go to that and we'll never post that. Conventions or workshops, ceremonial events, press conferences, candidate forums, testifying before the legislature if it's not something directly related to us, and they never give us money, so that would never apply. Next slide, please. You already did that. Our notices have to be posted 72 hours in advance. It's not 3 days, it's 72 hours. So if we want to have a meeting on Friday and we want to do it at 2 in the afternoon, we can actually post it Tuesday, Wednesday, Thursday, Friday. So we can post it Tuesday at 1 p.m. It can be barely 72 hours, but as long as it's 72 hours and we have it all the right places, we have to have it at the clerk's office, have to have it posted outside in the case, and have to have it on the internet. Once we do that, we're good. We've noticed we've noticed all of our committee meetings. There's a lot of AG opinions and case law. If the committee's recommendations are routinely rubber stamped by the full board, then you have to notice them because it's basically a de facto board meeting. Publicly accessible place and on the internet. Next slide, please. Closed sessions. So closed session, the only way you can meet is closed session if there's a specific exception. You guys have seen them all that apply here. Real estate attorney is the most common one. Personnel matters, another common one. That 085 is sort of a rare one that applies to central health, certain healthcare, boards of certain healthcare bodies. And then gifts. So if Central Health has gotten a gift one time, you can meet in closed session for gifts. Next slide. Video conference meetings, there are a lot of things that apply to this. The things that I would really focus on is, again, you have to have a quorum in person. If you're on the video feed, to be counted as present for deliberation, so when you're going to talk during an item or for voting, you have to have your video on. People have to be able to see you and hear you. It doesn't apply to the public ever, so they can give public comment. You'll note that one of our public commenters this evening was by phone. That's perfectly allowed. That's allowed. A lot of people got that wrong because of COVID. During COVID, they were like, oh, how do we interface with the public? A lot of them don't have internet access, and they were actually misreading the statute. It has always allowed public comment without video. The technicalities of it, that's the announcement that we make at all the beginnings of our meetings is important because it's really the staff's job to keep track of who's on and whether the feed is working and all of that. And if it's not, a couple of occasions we've had to tell Dr. Bell, hey, the audio's not working. And if the public can't hear us here or elsewhere, then we have to stop and make sure that that technical issue gets fixed. Next slide. One of the most important things to remember, and like I said, one of the things we like to focus on is things that are important to all of you. The legislature, there was a case of county commissioner out in West Texas who didn't like the way the statute was written, and he sued, and it went to the Texas Court of Criminal Appeals, which is the highest court for criminal matters, which is what this is, and they declared the statute unconstitutionally vague. So the legislature changed it, and then the current statutory language is it's a walking quorum if the member knew that the discussions involved or will involve a quorum, and it would constitute deliberation once a quorum is aware of it. So it has to be both halves. It's actually a pretty high bar. Senator Watson made this change. Next slide. The best ways to avoid this is don't communicate with fellow board members too often outside of a meeting. You can express individual opinions one-on-one. That's not a problem. The real difficulty arises when one member talks to another member who talks to another member, or one member talks to multiple members on the same subject. So that should be avoided at all costs. Next slide, please. These are just the penalties for that. Not really necessary to go over that. And next slide. That's all I have, and I'm available for any questions. We are available for any questions on either half of that.
Manager Kitchen.
On the audio recordings, is there a time frame that they must be kept for?
The only time frame that the act doesn't specify a retention period.
Okay.
It is a record of the organization, and it is required to be kept as long as you say you're going to keep it in your records retention schedule that you file with the Texas Library and Archive Commission.
Okay.
And on that front, we're going to need to post, I just remembered, we're going to need to post an item to change our designee. We have a board resolution that designated Mike Gieslin as the official records liaison for the agencies, for the district. So we're going to have to put that on the agenda and get that changed. Sorry. So.
Thank you, Manager Kitchen. Manager Valadez.
Okay, a couple of questions. One, I'm going to get to something that I have been concerned about for a long time. Long time. How does community care get away with not having public meetings, or even, so where do you have public comment if they're not having public meetings?
That one's pretty easy. They're
easy.
Not a governmental entity under the act.
So I think what I'm referring to and asking about is Central Health wanting to implement a best practice and how we conduct business. and open and transparent manner. And I would assume that our enterprise would be held to the same standard. If we're going to say that they're not a governmental entity, but yet they're operating as part of our enterprise, how do we differentiate between them? I have asked whether or not they could have the public part of their meeting, in open session, and then go into executive or closed session if they needed to conduct or transact business that would impact, their proprietary information. Especially when it came to, the clinics, how many people are going there, blah, blah, what services are they going for? So when they make their report to their board with reference to what clinics may or may not need to be closed or services amended for that particular clinic, that I can understand that. But for public input and public communication, I hear MAP and patients that receive services at community care, it's like, well, we'll never be able to be heard. So, it's a moot point. So I just wanted to ask around how to get around that and whether or not there's any way we can work with Jason and the community care board to at least modify or adopt some changes.
Mr. Giesman.
That's number one.
So this is obviously a non-legal opinion, but from a practical standpoint, the way that we accommodate that level of transparency is we have the quarterly updates. And so it's not just on their financials, but it's also on their work activities and patient service levels, outcomes, et cetera. And again, those happen quarterly. Now, granted, it doesn't give you a seat, in the board meeting as a public, as if they were a governmental entity, because council's right, they are a nonprofit entity that is not subject to the Open Meetings Act, so that you can hear the board deliberations. But that is one way that we try to get that information out there so that the public does see it.
I think what I'm referring to specifically is public communication. I don't need to hear their business until they give us a report, but public communication cannot happen if there is never a notice for an agenda item that says we're going to have public communication. It doesn't happen in a vacuum. So that's what I think I'm referring to. Is there a way that we could try and look at that? Okay.
Can you go to number two?
Number two, are we no longer televising our meetings on the Travis County television station channel? And if not, then when did that occur?
I believe, and I'll ask somebody from the comms team to correct me on this, but it occurred probably around the start of the pandemic, if I remember correctly. But we've also since had another challenge in that the technology compatibility and some of the disruptions that we were having in trying to make that broadcast happen, it just didn't lend itself to continuing to do that. Now, obviously, we're still live streaming. We put our meetings out there on video archive as well. But I'm hitting this at a very high level, Manager Valdez, and I'm not fully responsive. And so the comms team, if it's within the confines of the agenda item, can provide more detail.
One of the things that I'd like for us to, for Central Health staff to look at, I think it was 2 years ago, we went through what we were told was going to be a technology issue, and that's one of the reasons we started meeting over at AISD. And after that, we came back here because supposedly the upgrades had occurred. I think that may be actually when there may have been a change in whether or not we were on the channel 17 or whatever it is, the Travis County channel is, but I would like to know specifically if that was in fact the case. And if it's necessary for us to upgrade our technology again, then I think we should do so. I noticed that our Central Health board meetings are being held, or they're being viewed on YouTube, and you have to have internet to be able and subscribe to be able to access YouTube. And so for making it open to the public, there appear to be some issues there. And as you all know, we're constantly fighting a digital divide with respect to communication or streaming or internet to poverty populations, which is who we are specifically created to provide services to. So I'd like for us to have a conversation, or if you can find out, David or Hasib, where we are at on that. That was number 2, and I think the last one.
Before you go to your number 3, a clarification. One of the reasons we went to the AISD was not for a software upgrade or a hardware upgrade. It was because of COVID, and this particular environment was too close for individuals, and so we went there so that individuals would be at less risk of actually contracting or actually providing the virus to someone else that was nearby.
I understand.
So that was the reason why we went to ASID.
But I do remember that there were some issues about technology upgrades and that's being needed.
Excuse me.
Yes, sir.
We talked about the upgrade of our equipment in coming back, but a lot of that, if I remember the conversation correctly, dealt with us moving into new administrative offices and being able to actually not only have a larger room, but facilitate getting back on TV, which we had done previously. Thank you.
Thank you, sir.
Number 3?
Number 3. But I would like to know the dates for that specific issue. And I'll go back and reflect on what we have recorded. The last issue was specific to the recorded executive committee meetings, a closed session. Now, there was a time when we recorded all our executive and closed session meetings, and those tapes were kept. There was a change made, if I'm not mistaken, it was last year, or was it last year?
Last year.
Last year, when we were told that a decision was made by you, Dr. Bell and David, with respect to not recording our executive or closed session meetings, but we did not have a conversation with the full board about that. And I'd like for us as a full board to, at some point in time, maybe with the new CEO, have a conversation about that. And so that's my last issue as to whether or not, especially since I understand that's a choice that we can choose to make as a board. And so, but we have to have a conversation about it as a board. So that's it.
Thank you, Manager Valadez.
Thank you.
Any other questions for David or Hasib? Thank you very much. Appreciate it. Okay, agenda item number 8, discuss board compliance policies and procedures, including A, CMP 001P compliance program description policy, B, CMP 0010P code of conduct and ethics for board members policy, C, CMP 006P reporting and non-retaliation policy, D, CMP -009P duality and conflict of interest policy, and E, CMP 009 SOP duality and conflict of interest procedures. Mackenzie Frazier, welcome. Appreciate it.
Hello, and also in light of time, I will also try to make this fast. Good afternoon, Chair and Board of Managers, and thank you for today's presentation time. My name is Mackenzie Frazier, and I'm the Central Health Compliance Officer. I do not have a presentation to display, but the 5 compliance documents that will be referenced here today are in your packet. In overseeing a compliance program, I must ensure that we not only align with our needs, but we also must align with industry standards. In our space, there are 7 elements or industry standards that must be in place to constitute an efficient and effective compliance program. These are implementing written policies and procedures and having a standard of conduct, designating a compliance officer and a compliance committee, conducting effective education and training, developing effective lines of communication, and that's our compliance and ethics hotline, conducting internal audits and monitoring, ensuring that we have well-publicized disciplinary standards, as well as responding to detected offenses timely and taking corrective action. But to the element or standard of written policies and procedures and standards of conduct, I would like to outline some compliance policies that support our structure, culture, and the transparency of the Central Health Compliance Program. These policies are, as mentioned, CMP 001, which is the Compliance Program Policy Description, and this policy just outlines the who, what, when, and why of the compliance program. The second one is CMP 006, which is the Reporting and Non-Retaliation Policy. This policy requires all employees to report in good faith any relevant or perceived wrongdoing without the fear of retaliation. Employees may report their concerns to Human Resources, Compliance, and our CEO. If employees feel that they are not getting the needed support, they're also able to report a concern directly to you, the board. The third one is CMP 0010, which is the Code of Conduct and Ethics for Board Members. And this policy outlines a set of standards for ethical conduct, as well as outlining how board members should conduct themselves. The next one is CMP 009, which is the Duality and Conflict of Interest Policy. And this policy gives guidance as it pertains to how to handle perceived or actual conflict of interest concerns. And then we have CMP 009, which is the SOP. And this SOP outlines how to mitigate the perceived perception of conflict of interest and also the needed disclosures. Also worth mentioning, as we continue to go down the path to practice medicine, I will be creating additional policies, additional compliance policies to support us in this space. The first one that has been created so far is FWA 001P, which is our compliance with fraud, waste, and abuse and laws and regulations. Are there any questions?
Okay, Manager Valadez?
Mackenzie, will we be getting a copy of the updated policies from you?
Yes, ma'am.
Thank you.
Yes.
That's it.
Any other questions? Okay,
Hearing none, thank you all for your time.
thank you very much. Appreciate it. All right, agenda item number 9, receive and discuss a Central Health Enterprise State of the Organization update. Mike Giesland will be presenting.
Go to the first slide. So members, I've presented this report a few years running now, and we always come and talk to you about activity reports or financial reports, but I think it's important to step back and look at Central Health as an organization and see who we are. And then I'll close this out when we go through these slides with the suggestion, because we are growing so fast and have added so many people. It's hard to bring everybody in, and you tend to see the same people from one meeting to the next, but I think there's a creative way to start introducing you to the more expansive team. So on this first slide that you see, this is a series of dashboards, if you will, but all this is fairly self-evident, and as you can see, it lists numbers and percentages where applicable, or at a minimum percentages. And I won't go through each one of these, but from a CEO standpoint, actually management standpoint, so this is available online. We have a CEO's intranet site, and this is considered a dashboard item, if you will. But this is one of those key documents that you need to look at quarterly and really get a sense about where we are. And there's some other slides that we'll talk about changes over time. This is a static snapshot for fourth quarter of fiscal year 2023. But a couple things that I'll point out is, obviously, with respect to racial and ethnic distribution, and you'll see this on subsequent slides, we've made some improvements, but we still have a long way to go. and employee tenure, I want to focus on those two 11% bars that are in the middle, the 2 to 3 years and the 3 to 5 years. Now, there's different schools of thought on this, but from an organization growth and life cycle standpoint, that 2 to 3 years and that 3 to 5 years, you really want those bars to be a little bit higher. Because you have to have that succession plan in place, and those folks that are learning on the job and coming in and helping develop new processes and procedures advance into leadership positions. And so the worst thing that could happen is you look at the less than 5 years and you simply don't have enough people. Now, the other thing that I'll point out that's obvious is the 0 to 6 months is at 21%. This is not unusual at all for a fast-growing organization where you've hired a lot of people in the past few months. I don't think that, it's my personal and professional opinion, I don't think that's abnormal given the growth circumstances that we're in. The next that I'll jump down to is headcount over time. And again, this, we talk about how fast we're growing as an organization. When you look at that, the exponential rise of that graph there on the right, starting at about 212 people in second quarter of FY 2022 and going up to 342 people, so over 100 people growth over that short period of time. Again, that just illustrates the rate of change that we're having in the organization. Next slide, please. So this is something that the board has expressed an interest in this over the years, is comparing what our employee population looks like from a racial and ethnic, a demographic view to the population that we serve. And while you can see that there's some proportionality when you compare both of those graphs, again, obviously, as I said on the first slide, we still have a lot of work to do. And I think that some of the workforce initiatives, if I could just have a quick aside on this, while it won't bring the equity and the equalization that we're looking for between these two graphs overnight, I know that we've started having some discussions. We've talked about working with ACC, but also there's some nonprofits in town that do workforce development. And bringing people on is where creating positions for the direct practice of medicine and hoping that future leaders for our clinical systems can come through these programs as well. And so I think there's some things that we're doing, and I would ask, probably at a future discussion, can certainly come in and talk more about our other recruiting efforts, which have been much expanded during Jeannie's tenure, that are seeking to work in other areas, not just including the clinical areas, but in other areas outside the clinical expansion. Next slide, please. So this is the EEOC report. It's known as the EEO4 report. This is an annual report that is required. We put this in here, one, because it's a required report, but it's a good dashboard to look at because it starts to break things down into general categories. Now, these EEO4 reports have many subcategories. I mean, they go on for quite a ways, but these 4 categories are important because it gives you a sense about what the distribution is amongst varying levels within the organization. As you can see here, what you're looking for, when you see the different, clerical officials, professionals, technicians, you look at these different groups. It's one thing to look at a static snapshot, but if you go to the next slide, which is the same slide, but what we've done is we've shown it for the prior year. You really have to take these two, and I'm sorry that we don't have, I should have thought about this, my apologies, but that we don't have these side by side. But again, whether I'm in your shoes or if you were in my chair, you would want to look at 1 year to the next and really looking to see, what is happening. And then I think it's more obvious when you go to the next slide. And we'll come back to those in a second because this speaks to the leadership within the organization. But what this shows is over a 5-year period, what has happened in the organization and having very deliberate recruiting efforts and in our growth and what we're able to do. And I'll pause for a minute because as you can see, there's some pretty significant percentage increases and the different ethnic and demographic groups that are represented on this page. Okay, we'll go to the next slide. So a quick note on non-binary gender identification reporting. In 2022, we began giving staff the option of self-identifying in terms of their gender identity. And we need to get to a point where our overall reported demographics better represent gender identification. And so since that time, 46 employees have self-identified their gender identification. So that leads to the next discussion here. And so this just shows the gender population change, again, over 5 years. It's similar to the racial and ethnic breakdowns that you saw on prior slides. Next slide, please. So this starts to get into the leadership, and I mentioned the leadership when we're talking about the EEO4 reports, and it's important, and this is just my personal opinion, but having been in organizations that are diverse and very deliberate about diversity and inclusivity, in both when I was with the state and fortunately here at Central Health, it's not a project or a task, it's culture, it's a way of being. And organizations that are diverse thrive. They thrive because they have different voices at the table, they have different people with lived experiences, different perspectives. And when I walk the hallways here at Cesar Chavez or at the building there on Airport and pause to have a conversation, just like at the community events, I always walk away with a deeper understanding because somebody shares something about themselves. Hey, I was I was discriminated against when I was in high school, or I was looked upon and biased at my old job, and so really understanding, having those voices is so important to achieving a level of understanding and emotional intelligence that I think is critical for any leadership body. So that's why we do what we do, but it is not something that you can ever ring the bell on and you never ever want to tell yourself, you know what, we're okay. No, you're never just okay. You wake up every day and you come and you embrace that culture and you keep at it and you keep at it and you keep at it, because there is a lot of damage to repair in the society that we live in. So let's go to the next slide, please. This is, we'll go through these, some of these folks, but just wanted to start to highlight some of the leaders. And so if we'll just flip through the slides and keep going. Just pause. Keep going. Stephanie looks really pleased with her job situation in that picture just before. But I've also included in this, you've seen some of the direct reports to me. If you'll pause for a second before we go on to medical executive board. Let's go back one slide. Also include as part of the executive team advisors, and this is something, and again, it's up to the next CEO to determine, what role people play, but it's important to have department execs that have that day-to-day management and that accountability within the departments, but also it's important to have advisors, and in this case, I have Juan Garza and then Rayette Smith-Hearn, who that report directly to me, but having those folks that operate in a different level outside of a department, but yet are very comfortable going into any department, having conversations, and then addressing multiple situations, both internal and external. And so as part of the executive leadership, those advisors are play a critical role in the organization, in addition to the department officers and execs that you've just seen. Okay, let's go to the next slide, please. So the next leadership group that we'll display here, if you can just keep scrolling through the slides, is our medical executive board. This is a board that was created as a result of us entering into the practice of medicine. And this is a statutory requirement, if I remember correctly. So, but this is important because, and I really, this deserves its own discussion, and which you've had before, but I think it's important to have it again at some point. But thinking about really who the physician leaders are and what we're doing in the direct practice of medicine, but it goes much more expansive than that. Again, I just wanted to show these slides of individuals that serve in these different leadership capacities. Okay, next slide, please. Okay. Some of the challenges, and I'll close out with this and then throw an idea out there. We have a budget resolution that you all have adopted that is invaluable when it comes to establishing strategic direction, but also internally as a management tool. We can look at it, we actually build our tracking documents around it, and we use it when we're out and about internally within the organization to talk about what are our objectives that we're trying to achieve. But there are a lot of items in that budget resolution that it's almost misleading because it doesn't really assign an order of magnitude to some of them. So when you say implement the healthcare equity plan, that's not an affair that's up and down in a day. It takes several years to get there. And so there's a lot on everybody's plate. And I think what we're starting to see, and again, this is Mike's version of things as he walks around the organization, is that staff are putting in a lot of hours and a lot of time, and they don't have any margin to burn on anything that is not essential to achieving the objectives that this board has set forward. And in some cases, I'm worried about exhaustion. I'm worried about exhaustion with the execs. With my constant texting and say, hey, can you step out and talk? I'm taking them away from a meeting. And I say, I'm really sorry about this. But am I sorry? I don't know, because I got to talk to you. But that sort of thing, day in, day out, starts to divert people's attentions from the work at hand. And I think that can lead to exhaustion. How we overcome this challenge, you have to, and I have to remind myself of this, and others, I have others around me that are not bashful about reminding me about this, is step back and let people do the work. And that can be hard to do when there's ideas floating around out there, or you have a sense of urgency around something that, maybe it's not urgent. And I know I'm still very much a work in progress in that area of discernment. And I'm not anywhere near close to what I need to be on that, but I think stepping back and letting people do the work is the antidote to that, and that takes organizational discipline, just like focus on an objective takes discipline. Another challenge that I mentioned earlier, you saw on the graph, was the rate of change in the organization and the growth. And some people are being moved into different roles, and it's new and exciting, and then some people are still continuing to do their current jobs, but the new role hasn't been created yet, or maybe it might not be created in terms of what their ideal job might be. But you see this a lot, and I saw it a lot when I was with the state. Anytime you have a lot of change going on, and things start to happen, people wonder, okay, well, what's going to happen to me? And it ranges from anxiety to elation to wondering, gosh, do I need to be here? Is there something for me here at this point? And what I would say to all staff everywhere that are within earshot is sit tight. You have a new CEO coming on board. Somebody said it best the other day, there's plenty of work to go around, and there's going to be a lot of opportunities open up and career pathways that we didn't have a year ago. So, there is a way to cope with this, but unfortunately, you can't lean on the elevator button and make it go any faster. So it is going to take some time, but not nearly as much time perhaps as people think. Identifying needed strengths and support operations. I've mentioned this before, that we're as a fast growth organization, one of the risks is outpacing your own abilities and your own supply lines. But again, there's a lot of things that can be overcome with good internal communications. I feel like we have those internal communications. We put it front and center in executive plenary meetings. Stephanie convenes a meeting, just like Monica convenes on the strategy side. She has an operational meeting that gets convened and where there's discussions. But I think forthcoming on this, and you'll see this in the performance review that's coming up later in 2024, is we're going to need to continue to build up policies and procedures. As we're building out our support operations, staffing, and infrastructure, along with that comes a lot of policy and procedure build out. And again, that takes time. but you've got to have that in place as a well-functioning organization. Another challenge, with the growth, and I mentioned this earlier, is not to lose sight of a single patient's needs or the value of each team member's contribution. So I'm thinking about people that work here and those folks whom we're privileged to serve. And we're in a sea of people, as I mentioned earlier, but you can't lose sight of the fact that people that work here, everybody has an individual contribution. It may be a very specific skill set, like an epidemiologist, or it may be something that's more cultural in nature, about how to be more inclusive in community conversations and in putting together recruiting strategies and job descriptions. And so there's different things that people have to contribute, but it's recognizing what those individual contributions are, and not just letting people get lost. That is difficult to do. You have to be deliberate about it. You got to be conscious about it. But I think it's an imperative, as we go forward. And then again, on the patient side, I've seen folks, Alan personally and Veronica Buiton Camacho and others, and I'm leaving out a whole bunch of people too, especially those that are in the transitions of care team, just drop everything that they're doing late afternoon or early evening to help one patient with a particular issue. And I hope we never lose sight of that, because it's so easy in a big system to try to set up these mass movement systems. It's like going into the fairgrounds. You just got this entryway and there's this turnstile, and they don't know whether you're there or not. They just know somebody came through the turnstile. Well, we don't want to be that. And so I'm very just honored, and just warms my heart to see people just drop what they're doing to, get somebody into a better wheelchair, or to get them admitted to the hospital, or to dislodge a pharmaceutical issue, but we can never lose sight of that. And so lastly, and again, I've said some of these things before in terms of challenges within the workforce. Another thing that can lead to exhaustion and fatigue is whenever resources get diverted away. And so the key resources being people, time, and money, and especially time. And, there's been, and some of this I have caused, and I own up to that. But when we pivot on something and somebody has to stop work on one thing that was so close to the finish line, and then we say, no, come over here and do this. Sometimes we have to do that. We saw this with supply chain disruptions. There was a lot of pivoting there. But sometimes it can come from external sources. It can be self-inflicted. But I think that's something else that, we need to be mindful of. Not only at the CEO level, but the board level as well, and the exec levels, about, when and how we might divert those resources. And the good news is, if there's a strategic redirection, that can only happen at the board level. I mean, as it stands right now. And so I think that that's one way of putting the brakes on things, is making sure everything that needs to come to the board, because it's a policy decision or a major strategic redirect, comes to the board, and there's deliberation on it and an impact analysis to determine, is this what we really want to do? Some of this is unavoidable. Like I said, you have things that are outside of anyone's control, and like a global pandemic or a supply chain disruption, or maybe there's a workforce challenge, just in terms of being able to hire people in the volume that we need. But where it's not unavoidable, meaning you can control it, I think we need to do what we can. So those are some of the challenges, but the good news is there's antidotes to this. There's ways to mitigate this. It's not just a throw up your hands, it's all hopeless. And this is a very, maybe this is the last time y'all will hear me say this, but this team knows how to embrace the scrappy and figure out how to get these things done. So you've got a good team that's both in this room as well as online tonight. Thank you.
Thank you very much, Mr. Geisman. Appreciate it. Any comments or questions? Manager Valdez.
Thank you, Mike. Did we ever get to the point where we could see an organizational chart that would outline what Central Health administratively, organizationally looks like?
Yes.
And
yes, we have been at that point.
We have been at that point.
But I did not think far enough ahead to actually put it in this presentation, and I am so terribly sorry.
If you could send for
that would have been nice of me. I'm sorry.
I appreciate it. Thank you.
I'll do that.
Manager Jones?
We'll send something out, but I'm sorry, can I just say real quick, it will be obsolete by tomorrow morning.
I'm sure.
Yeah, it moves fast.
I appreciate
Yeah,
that.
we'll do something.
Because if I'm not mistaken, one time, I mean, when Susan left, that was before Jeannie came on, she had promised us a copy of that with the responsibilities and salary range of the people who held those positions. So that's something I was wondering if it exists, or we just wait till next year and after the new CEO comes on and see what that
We
looks
have a
like.
basic org chart that we can send around.
Appreciate it. Thank you.
Thank you, Manager Valdez. Manager Jones.
Yes, thanks very much, Mike, for the information. That was very, very informative. I have just a couple of quick questions. The first one is the data on employment, is that Central Health or Central Health Enterprise?
Excellent question. So tonight I just focused on Central Health proper. We do have enterprise expansive workforce data. I didn't put it in this presentation again because I was just focusing on the state of Central Health. But let me get with Jeannie on that and see about how we could get that to you, or perhaps, if not a future presentation, at least send something around to you.
Okay, thanks very much. That's important because I think, and it goes to what we've been talking about for some time, is are we a organization that's made up of different parts, or are we a organization that are all one part, but we do different things? And I think it's important for us to understand how we look internally when we look at that. So that's the first question. So that data would be very helpful. I appreciate it. The second thing relates to is the demographics of the populations that we are seeing. That was very interesting data. In a later time, maybe the board will be able to look at that, particularly in terms of the area and what we can do to address that. And then the last item was, I think it's important that we, and it goes back to the marketing thing of the enterprise, is that if we are going to be an enterprise, then we have to sell ourselves that way. We have to be out there visible. We have to be interconnected. And I hope that the new CEO, whoever comes in, will buy that as well, because when you're out in the community and you said you're part of Central Health, people say, well, what is that? And you explain to them, the first thing they tend to go to is, oh, I thought that was community care. So we still have a long ways to go to help people understand how we interact, or some of the other, Sendero, for instance, is another good example. We have to, either we're going to do that and make it an enterprise, or we're not, and we just need to acknowledge that.
Yes,
I think
sir.
you've done a great job in your time here in pulling us together. I hope we can go further in a unified effort to make that a synergy there.
Yes,
That
sir.
was it. All I wanted to say.
And as far as that brand identification, I know that, we've presented to the board before, and, when we think about workforce and who we are and how we're aligned, I know there's some either has recently occurred or upcoming discussion with the Community Care Board in January. Thank you, Ted. That, granted this work, it's the prerogative of the board to keep moving, but it's my recommendation that we do keep moving forward on that branding initiative, because I think that'll help, based on our patient and community research, help clear up some of the very issues that you've just raised.
Thank you.
Thank you, Manager Jones. Any other comments or questions? Hearing none. Thank you very much, Mike. Appreciate it. Agenda item number 11, receive and discuss an update on the co-applicant agreement involving Central Health and Community Care Health Centers. Mike Giesland and Monica Crowley will be presenting.
So members, agenda item 11 concerns the co-applicant agreement between Central Health and Community Care. And it's a foundational document, and the reason why we're talking to you about this tonight is really just to get a psychological level of awareness, just so you know this issue was out there. What we're going to present to you tonight is it's all discussion and open session. We have a few things that are of legal nature, and so they need to be discussed in closed session. But for purposes of the open session, it's not really to establish this baseline working knowledge that you will need at some point in the future, because you, meaning the board, have a decision coming up in 2024. And that decision being, what changes are made to the co-applicant agreement. That's not something that the CEO can execute on. That's a board prerogative. So that's why we're bringing this to you today. So it's going to be a very high-level discussion, just to, again, generate a higher level of awareness. Couple things. Where we are right now is Jason and I, to this point, it's been CEO to CEO. And that's been deliberate, just to try to get some basic concepts down on paper about where we're headed, realizing that this needs to be farmed out to subject matter experts and legal counsels before we even bring anything to the board to look at. And so we're still, I would say, at the early steps of this process. Jason and I, we've hosted each other in our offices, and we've had probably 3 or 4 times just exclusively on this issue. Don't hold me to the exact count. And had just as many phone conversations about this. So this is not something that we've just talked about in passing. We've set aside quite a bit of time in our respective schedules, because it is so important, and it is foundational and fundamental to our working relationship and our partnership. So right now we've exchanged concepts. The next step is to start getting a set of red lines, going back and forth, that ultimately result in something that we can bring to the respective boards, so that you all can make the decision that you need to make. Now, when those red lines show up, that's when this board will need to get more into the jargon, the definitions, understand more about the Health Resources Services Administration, HRSA Compliance Manual, which is the federal document that you use to guide the creation of the co-applicant agreements, but also what the amendments would look like. So I'll touch on a couple of high-level things here about some of the concepts that we've talked about today. First of all, what is a co-applicant agreement? And it's an agreement between a grantee, Central Health is the grantee, and the co-applicant community health center, in this case, community care health centers, that delegates the required authorities and functions to the co-applicant board. So that's the grantee granting to the co-applicant board, being community care, and delineates the roles and responsibility of the public agency and the co-applicant in carrying out the health center program project. Now, when you get to that phrase, program project, when we think of a program, we might think of dialysis or community health care workers and patient awareness and education. Program is much more expansive the way that it's used in federal terms. It is everything, basically, that happens under the sun within a community health center. So, and what I just read to you was directly from Chapter 19 of the HRSA Compliance Manual that was revised in August of 2018. Sticking with that August of 2018 HRSA Compliance Manual, 2 more things that I'll just put out there again, just high-level awareness. And I quote, "To the extent possible, the health center must coordinate and integrate project activities with the activities of other federally funded, as well as state and local health services delivery projects and programs serving the same population." So again, you see this more expansive coordination and collaboration, but then to go further, for public agencies with co-applicant boards, which we are, the co-applicant board and the public agency determine how to collaborate in carrying out the health center program project. Again, there's the word program, which is everything. And that, for example, could be shared project assessment, public agency participation on board committees, meaning our participation on some of their board committees, joint preparation of grant applications, et cetera. And so from a board member's perspective, and I'll turn this over to Monica to fill in, what we can in the open session. If I were in your shoes, it's thinking about, one, what the constitutional weight that this co-applicant agreement has on the partnership going forward. But as you start thinking about priorities, so for example, same-day walk-up access, and I might be mashing 2 terms together that need to be separated, but you think about weekend hours and extended hours during the evening hours on the weekends. street medicine for persons experiencing homelessness who are unhoused. Those things that are priorities, making sure that there is that organizational partnership structure in place where those priorities are acted out on and in a timely manner. And so this is a place where you start lining those things up. Those are not purely transactional issues. That requires an understanding about what the partnership is supposed to be doing. So this is an opportunity for you all to engage in the future at the right time in this important document, but also with your appointees to the Community Care Board, and ensuring that there is alignment for the things that, when we look at the needs of our patients, that, and it goes both ways. I mean, that we're doing together what it is that we need to do to serve those patients to the best of our ability. So that concludes my open session remarks. At this time, I'll turn over to Monica to see if there's anything that needs to be thrown in or corrected.
No, not in the open session part.
Okay.
All right. Thank you very much. I'd also like to take up agenda item number 12, and that would be discuss updates on matters related to the performance review contracted by Travis County, including delegations to the president and CEO to execute necessary agreements with Central Health and Travis County and Mazars USA.
Could I ask a question on 11?
Yes, ma'am.
Okay, just a quick question. Actually, it's not a question for now, it's more for later. I think that, at least for me, it would be helpful to have a list of the changes that are being considered in the co-applicant agreement before you get to the red line stage, just the concepts.
Sure.
Don't need that today, but I think it'd be helpful for the board to understand what concepts are being discussed.
Absolutely. And I can, probably what we'll do is we'll send this document through legal counsel for the time being to the board. But they need to look at it, but let me figure out how to get that to you.
Yeah, I'm just thinking that the board may want to know that before we get to a point where we're approving an agreement.
Okay, any other questions on item 11? Yes, Monica.
I do think we have closed session, so I want to make sure that we get to go to closed session in item 11. Well, I have updates in closed session, or closed session updates for item 11 that I was hoping we could.
And we are going into
Okay.
close,
Okay.
all right? But I just wanted to take the opens first, so I don't have to, when I get out of close, we're adjourning, all right? Agenda item number 12, discuss updates on the matters, I think I read that. So it's Mike Easton.
We do not have any update at this time. Information continues to flow.
All right. So, agenda item number 10, receive updates on strategic objectives pursuant to the fiscal year 2024 budget resolution as amended, including updates on work involving delivery of healthcare operations and partnership initiatives. Agenda item number 13, receive and discuss a briefing regarding Travis County Healthcare District doing business as Central Health versus Ascension, Texas, FKA Seton Healthcare Family, cause number D1GN230000398. Agenda item number 14, receive and discuss a briefing regarding Birch et al. v. Travis County Healthcare District doing business as Central Health and Mike Giesland, cause number D1GN170058824 in the 345th District Court of Travis County. Agenda item number 15, discuss and take appropriate action on a Community Care Collaborative Board appointment. And agenda item number 16, present an update on the president and CEO position and take appropriate action as necessary on a potential offer of employment for the position. It is Wednesday, December the 13th at 8:00 p.m. I announce that the board is convening in closed session to discuss agenda items 10 11, 12, 13, and 14 under Texas Government Code Section 551.071, consultation with attorney, and agenda items 15 and 16 under Texas Government Code Section 551.071, consultation with attorney, and Texas Government Code Section 551.074, personnel matters.
We think, Dr. Bell, you may have missed reading number 15, the CCC appointment.
No, I
Did he read it?
that one.
Okay, sorry.
Yeah,
It can be.
yeah,
The vote is
everyone
the
asked
vote
for
is
it to be
open,
that
but
way,
the-
that's why it's there.
Yes. Sorry. I misunderstood.
Got it?
We are good.
All right.
We go into closed. I misunderstood, sorry. No, but it can.
I'm doing well, sir, how are you? Okay, members, we have come out of closed session. It is Wednesday, December the 13th, and the time is 8:42 p.m. We have one motion on agenda item 15, discuss and take appropriate action on a community care collaborative board appointment, and I recognize Dr. Martin.
On at the wrong time. I move that the board approve the appointment of Jeff Knodel to the Community Care Collaborative Board as recommended by staff.
And do I have a second?
Second.
I have a motion from Manager Martin. I have a second from Manager Kitchen. Any further discussion? Hearing none, all in favor?
Aye.
Any opposed? Motion carries. All right. Agenda item number 17. Confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for Wednesday, January 24th, 2024 at 4 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. Manager Valadez motions to adjourn, and Manager Brinson seconds. Any further discussion? Hearing none, all in favor?
Aye.
Any opposed? We are adjourned. Thank you, members. Appreciate it.